I would say that would, she could probably apply for a pass for those specific days.
Uh-huh.
If there's no other arrangement that can be made. Because here's the thing, once we start doing that for one, everybody's going to say, well, I need my sister to babysit for me so I can go to my appointment here and there, Yeah. So it's really important that we are able to screen these requests as well. So,
okay. And then the screening, I guess, is my next question. In the travel passes, it says there'll be, a place where you can print the application for a travel pass. How long will that take to get set up? And I know the email will take like 2 minutes to get set up for that. But do we have someplace in mind where we can put that? Can we put it on the website and the Facebook page?
Yeah. So I think Jesse is putting it in a Google Doc deal. So that's why it was left blank, because I didn't have the information, but it's probably ready to go as we're speaking, but we'll add that in there. And of course, all of this information we intend to put out to the public. This plan and this ordinance will all be made available to the public, so for their reference as well. So,
and are we going to assign someone to help people in the districts, like someone from the CAP office or something, who can help them fill out so they're not on the road, trying to go someplace to turn in the application?
Yeah. So the district chairs are supposed to be available to help them, and if they're not, then Pine Ridge District Task Force will assist them, and that's why that phone number, I read that phone number off. Yeah. That will be for any other districts that don't have anybody within their district who can help them. They can call the Pine Ridge District Task Force, and they'll help them.
Right. And then there was no mental health plan. It wasn't in the email, but that will be made public as well, right?
Yeah.
Okay. I guess basically those were my questions and my opinions. So okay. Thank you for answering.
Thank you. And I took note of it all. So
thank you, Councilwoman Whitehorse. Councilwoman Sears.
Yes, thank you. Thank you, Rianne. I just wanted to bring up some of the concerns that are being brought to us. And I think one of the things is we need contact numbers. I think we should have a list of people that our population out there can contact, like if they're having a food issue, medical issue, to get to their appointments. There should be contact numbers of who to go to instead of we're, guessing who's in charge of what. And so I think we need to at least get some type of list of numbers so we can get it out to the general public, because they do call us, and I would like to have a list too so I could kind of direct them on who to call. And the food issue, are we realistically ready to handle all the people who don't have access to any payroll at this time? Maybe I'm hearing that IHS or BIA, their checks will be in after Friday, and they wouldn't be able to do any shopping. So those are the concerns that we're getting now on our food issues. So, and also I do have a district member that has to go after somebody in treatment, leaving Saturday and then coming back Sunday. So to attain a pass for that day, then we need information on who to contact on that also, so that they're able to get those passes prior, because it says 3 days prior. So, we need to make sure it's something that our people understand and we understand, on the resources on who to call, who to have, who gives out these passes, and who's dealing with food. Those are the type of things, Rayanne. Is that possible to get that done also?
I think so. One of the things that we did put in the travel pass plan, though, is that the person that is issuing the passes, we don't want to give that person's number out, but they can do the application process, which we just discussed, and the district chairs can help them fill out those applications. If they're not able to do that, then they can reach out to Pine Ridge District. But we can definitely get a list of what, who will be available for contact during the lockdown period. So, and that we can make that public.
Okay, that's good. And I'd like to yield the floor to Mary Tobacco. She's our district chair, if she has any questions. Mary, you on? Or maybe she's not on. I thought she was.
Okay, if she comes back on, just let me know and we'll.
Okay.
Thank you.
All right.
Councilwoman Little Hawk, question?
Thank you, Mr. Chair. I guess my question, I pretty much really don't have too much questions this morning. I've been sitting in on the task force meetings when they were meeting, so I kind of know what they were bringing forward. But I do want to say that, when we're talking about the 48 hours or the 72 hours, I think we need to give some time here. I know the tribe gets paid tomorrow, so we're getting calls from tribal employees as well as the college. The college gets paid on Friday, and their Head Start employees also. And they're asking for some time so that they can get supplies or food so that they can have, that available to them during the lockdown. And they don't get paid till Friday. So I think in the discussion with the task force, those are some things that I did bring up in the task force meeting. So I hope today we can, as council, take those into consideration too when we're looking at the 48 hours or the 72-hour starting this lockdown. I think in the task force, I know one of the recommendations they did talk about, and they forwarded it to us to maybe make that decision today, but to start it on Sunday. I think it was Sunday morning and ending on Sunday, next Sunday. So I think today we should, really look at that, because not only does our tribe get paid tomorrow, they're also saying, could we get our checks early? So I don't know if that's available to them today, or is it still going to be issued out tomorrow during payroll? So I guess those are just my, concerns for the employees and the people that work in other entities that are also calling us. So, we need to take those into consideration too. And also one concern was the people in general that don't work are basically the low income, families, I think is also a concern. And I think that during the task force meetings, those were discussed. And I'm glad that this morning they brought forward a food plan and a food budget. And I think that was one thing that they were going to work on, which I'm really glad that they're able to bring that to us today so that we can look at that to make sure our people have food. We're just getting tons of calls and text messages, and people are getting upset, out there. And, they're not happy that, why are we doing a lockdown when the virus is here already? Those are some of the comments that I'm getting. And Oyateki out there across the reservation are concerned about the number of cases of COVID that we have on the reservation. The numbers are rising, and our people out there, we need to understand that the reason for the lockdown is to, try to control this virus. We can't make sure everybody doesn't get it, but we have to do something today. So I do understand that this lockdown is very important and the people do want it, but there is some people that are not happy about the lockdown. So I just want to say that's the reason why we're talking today. And we hear you. We hear what you're telling us, but at the same time, we have to look out for the best interest of our Oyate across the reservation, so that we don't have these numbers rising and rising every day. And it is a task right now for our the COVID workers. And just what I've been hearing in the task force meetings, they really need some time to catch up and start getting a handle on all the families that are in quarantine or the ones that are in isolation. So to us, I think we just need to look at all of that. So let's take a look at that 72-hour, giving the people time. We know it's serious, but I just wanted to throw those things out there so that the rest of the council could think about that. Thank you.
Thank you, Councilwoman Little Hawk Weston. Councilwoman Merdanian.
Thank you. For the most part, again, I feel that, in working in conjunction and collaboration and coordination and being able to communicate across the board where it's not one particular entity who's responsible for enforcement. And, there's a timeline that was developed looking at all of the ordinances to protect our people from this pandemic. And with that, we talk about the third phase, and that's the whole shelter in place. The shelter in place ordinance was to prevent the spread, and essential travel was defined. Essential employees was defined. And with that, I appreciate the work, but there still needs, having a plan to make a plan still does not sit well with me. And with that, we still haven't addressed our homeless. We haven't addressed our, overflow, those tents that the tribe purchased for the overflow and the capacity at the hospital and the clinics. The tribe invested in those. They should be getting set up to alleviate some of that stress with our people. And, all of what we're doing is to, protect our unchis and gakas, lalas, and looking out for the welfare of our people overall. But at the same time, we really need to have those plans in place and defining the roles and responsibilities of our people who, like Miss Sears said, we need that list, and we need to know when and who and what and how, and that information needs to be communicated to us as well so that we can communicate to the people, because we do get those calls. We get the calls when the word lockdown is mentioned, for and against, and concerns and frustrations. And for the most part, it's also looking about, our people and looking to help them as well. Because we're all supposed to be related here, but we still have a lot of our people who are stressed out, and that has an impact not just on their mental health, but also their physical health. And we need to try to find ways to eliminate some of that stress. And with that, that's where the plans come in place. We should have several other plans in conjunction to these plans. And with that, and communications is an important piece of this, so that our people know who to call, where to call, and have some comfort in that. And so with that, I believe in the past I did make a motion on council floor to have a call center. CHRs were tasked with that. However, I feel like there was no true plan in place for that. And it feels like, we can really improve in different areas for the benefit of our people. And like I said, that is working in collaboration and really focusing our resources and providing those needs to our people, providing and meeting those needs of our people. So with that, I have a lot of questions, but for the most part, because I've been listening and attending meetings and so forth and keeping an open mind, I think it's important that that even within that food delivery plan and so forth, the passes need to include that day labor, because we're not including them in there either. And so, and where does the district service centers fall within some of this? I have a lot of questions, but I'm just going to leave it at that. Thank you.
Chair, I think Mary Tobacco's on for Wakpamni District.
Thank you, Council, for all the listeners. Be safe and be well out there. I know it's a hard time. We were waiting for the outcome of this meeting to figure out what the Wakpamni District is going to do. All of the other districts have plans in place for lockdowns. For lockdowns, and so I'm kind of here to speak on, from our perspective, we submitted a resolution today because the food right now at this time of the month is so important for people, and we submitted a resolution, a plan. All of the details within the plan that the task force presented, I appreciate their hard work and all of the time that we devote just about every evening to create these plans. And I think a real solution, a real quick way that we can help with it if the lockdown, and it was recommended about 3 weeks ago that we have a lockdown to help slow down the spread of this virus. And we consider the ranchers, the farmers, not just the beef ranchers, but those that are ranching buffalo. They need to get hay and food and stuff to their animals and the horses. So we considered that in the plan for the passes too. So if you're listening and you're worried about that, I think don't worry, because we know that's essential. And but the lockdown is important, but to consider that we were warned 3 weeks ago that we're going to have a lot of telephone calls for breathing emergencies, because that's what COVID does. It attacks the respiratory system. So with this plan, we need to also consider that people might be coming out of their homes and their cars, flying to the hospital. And so we need to have that resource out there. Who do they call? What do they do? What's the wait time if you're in Wombly and you're calling the ambulance? We need to consider all of those if they're going to get out on the road and speed to the hospital, then, because we're seeing it now. So I think the lockdown is important, the shutdown. For Wakpamni District, we extend in 4 directions and we cover a lot of ground. So for us to have a lockdown without the tribal council support would be real kind of fruitless. So we need the tribal council support. But as far as funds for people, we submitted a plan. We think that if we trust people to buy the food that they want and they need, because people know what they're cooking, they know what their diets are, they know what their needs are. and we shouldn't try to control that so much. We can't expect everybody to shop at Bowie's. I think if we and that's what the resolution is that we proposed, is that we also we just give them a check for the length of the lockdown period. And if you want to know like how we could do that, each of the districts is capable of printing their own checks. And I'm not saying take it from the district's current account, but from the tribe's cares fund to get to the households. And that way people can buy their own food, buy their own formula, buy their own snacks, get their own medicine. We need to trust the people, because we can't dictate to them. What if you only eat organic food? What if you don't even eat meat? What if you have dietary restrictions? I mean, we just have to provide the resources to help people shelter, lock down successfully. So I tried to get that resolution.
Sounds like we may have lost her. A couple more hands up. Councilman Little White Man.
Oh, jeez. Hang on. What was brought to me, and I brought up a few days ago, was a call center, because of all the numbers that are given out and directed to this person and that person, and nobody's ever answering these phones. So is there a way that there can be a call center that is their main point is to answer these phone calls? Because there are people out there that just, are panicked, and then they're worried when they test positive and they can't get help, and they're at home, and nobody calls them back, so they go like with days without any help or assistance from any CHRs or anybody really. So is there a way we can set up this call center to where their phone calls are answered and they can get the help, so they got at least that peace of mind that they have somebody they can reach out to?
Right. Just in our last task force meeting, we was in there and we did. I'm going to be working with the treasurer and our property people to establish a call center for that purpose alone. And then during the lockdown, my office is going to serve as an emergency command post so that phones will be operational around the clock until we can get that COVID call center off the ground.
Okay, and that'll be. Is the call center going to be available all the way through the pandemic, or to the pandemic, I guess?
Yes.
Okay, thank you.
Thank you. Councilwoman Tapio?
Thank you, Mr. Chair. I'll be some very good comments shared here. And I guess something that first I wanted to say is to Rayanne and all you task force members, you did an excellent job putting together information for the quarantine people. And I think there's probably a lot of them out there. And I hope that they're all getting the same information that I was given when I was put in quarantine. So it was very good, very comprehensive. The thing I wanted to ask about, and I don't believe I heard it, and it's in regards to exercise. Okay. So I wanted to know what the position is on exercising during the lockdown. And I guess the thing I want to say and point out is that, lockdowns are disastrous for people who exercise daily, because if you're healthy, you become unhealthy. And if you're already unhealthy, you become unhealthier. And lockdowns really wear on people's mental, emotional, and physical wellness. So will the people be allowed to walk, ride bike, or exercise during the lockdown? That's my question.
Ms. Reddell, if you can respond to that question.
I don't think there will be any opposition for people to step outside their homes and get some fresh air, remain within their home area. I think that we don't want anybody out walking or running or anything during this lockdown period, because that encourages others to come out, and then they tend to gather and start doing group things. And so I understand, the concern for the exercise piece, but there's alternatives to running and hiking. Bear in mind, I just want to put this kind of in perspective for everybody. If we had a blizzard tomorrow and had to shut down till we could dig ourselves out. I mean, we've had that in the past where we've been snowed in for a week to 2 weeks. So what happens when we have a blizzard? Our emergency command system, our emergency response system kicks in, and that's what we need to envision this to be. And so everybody, what we're trying to do is just help people to stay in place for 7 days. And it's a difficult task. I understand that. We all understand that. But what we're facing right now, you just said it, people are calling because nobody's been in contact with them regarding their positive test. Nobody's providing them information on how to be in quarantine. And that's because we've got over 300, I don't even know what the numbers are right now, but I wouldn't be surprised if we've reached 400 active cases today. So, and we only have a small amount of people who are able to respond to all of this. And so that's why if we can do a lockdown, it will give us time to do catch up so that our responders can get caught up enough to deal with the ongoing incoming cases that are occurring. So I just wanted to throw that out there just to try to put it in perspective. And everything that you guys are asking about and recommending, I really appreciate it. And I am making notations so that we can include all of this so that we address it. And by the time we go actually into the lockdown, we should be adequately prepared. My question is, what happens to the homeless when there's a blizzard? How do we respond as a tribe in those types of situations? How do we respond to individuals who are snowed in and run out of food? If we look at it in that same kind of scenario, this is how we're going to respond. But I think we're even ahead of the game because we're allowing that time period for people to prepare. So as long as everybody has the opportunity to prepare, and then for those that run out of food, and I honestly believe nobody will starve during the 7-day lockdown period. For those that do run out of food, there is a backup plan. And then with the food vouchers, if that's approved, the food voucher / food card, individuals will have the opportunity to purchase their own food. So, I mean, it's not a perfect plan. And we have a large reservation. And I think we're taking a huge step here. But the bottom line is, we're in between a rock and a hard place. And we have the choice of either continuing to see the skyrocketing numbers and be unable to, we're going to lose control, total containment ability if we continue the path that we're on. And so with the lockdown, it's not ideal, but it will help in decreasing the spread. So right now we have positives who we haven't even received the results yet. But we know they're out there because this is what's happening is people are testing positive, but we're not getting the results in a timely way enough to start doing the contact tracing. So, and they're asymptomatic. So we have people that are out there asymptomatic that are wandering around and doing their daily business, but passing the virus on. So this is why we need to lock down. And
Mr. Chair. Oh.
Okay, I'm sorry.
Go ahead.
I'm done. Thank you.
Oh, Okay, Mr. Chair, I just have a couple more comments before you go on to the next person. The next one I just want to share is that, I've been polling a lot of the people in my community, and a lot of them are not for it. But I think in the long run, after we look at the burden and the hardship that we're putting on the medical facilities and the emergent personnel and everything, and with the numbers rising, I think that this is something that is really needs to happen. I agree with that. Now, my biggest question is, what are we going to do about the homeless people that are back here by the Presbyterian Church gathering in large numbers every day, every night? They're there. So if we're going to call a lockdown for 7 days, what are we going to do with those people? We need to figure that out. Thank you.
Thank you, Councilwoman Tapio. Councilman Wilson?
Okay, thank you, Mr. Chair. I got a lot of questions actually, but I was kind of interested in what Miss Tobacco. We cut Miss Tobacco off, and I would like to let her finish her presentation if she is still on. Before I ask my questions.
Okay, Chairwoman Tobacco from Wakbamni, are you there? Sounds like a no-go at this time, Councilman Wilson.
Okay, thank you, Mr. Chair. I guess I got a few questions and I was writing them down. And I'm going to start with our shelter in place. Lots of the stuff we're talking about already is in the ordinance of the shelter in place, and it's not being enforced. The police chief last week at the Law and Order Committee meeting said he was down, I think, 15 officers last week. So I guess the first concern I have is the enforcement of this lockdown versus a shelter in place, which is kind of pretty much the same thing we're asking. We're just rewriting it in a different term and using different words. And right now, the shelter in place isn't being enforced. I'm pretty proud of Medicine Root. It seems like the curfew is being followed pretty well, and our numbers have still inclined. And then going back into the actual the recommendations that the task force asked Rayanne brought, and I want to compliment them because they have worked very hard the last several months on this. But when you start finding the businesses, has anybody reached out to the revenue director to see if he has enough staff to make sure the businesses are in compliance? Because I know the tribal building is on very minimal personnel right now as well. The doctor's appointments, I guess I have a concern with who. I think it should be up to the individual whether they decide their doctor's appointments are essential or non-essential. If they had a doctor as an appointment, my opinion is they're all essential doctor's appointments. I got a question on the 14 days when the CDC come here a month ago, or maybe 2 months ago now. They recommended 10 days, not 14 days, but yet we're still on 14 days. And after the CDC we're kind of revised. On the food, we're going off 4 people per house. I don't think that's a realistic number. I know very few houses that only have 4 people per house. So I think the numbers are not matching with only 4 people per house on this reservation. And then I'll kind of get to the passes, the turnaround time on an application for a pass, as well as this tribe runs strictly on the income off the land leases, and of course we're talking about ranchers getting 1 per ranch, but right now, say they sell their cattle in Gordon, Nebraska, that sell barn's probably sending trucks up from Nebraska, and they wouldn't have a pass to get to the ranch if each ranch is only going to have 1 pass per per ranch. And then I also have a concern about not testing during the 7 days, or maybe even on to the 14 days. It says we can lock down up to 14 days. Well, if we're going to cease testing for 14 days, of course our numbers will drop because we're not doing them tests to actually see if the tests are working. And then, of course, lockdowns. I also fear that you lock somebody down together for a week, possibly 2 weeks, the amount of domestic violence that will raise locking these people down. But and I want to get into the essential and non-essential businesses a little later on. We'll see where this goes to. I know we're having a hard time keeping up with 300 to 400 people right now. If we do a reservation lockdown, how are we going to respond to 20,000 people if we're having a hard 400 people? So them are just some of my concerns, I guess, right now, and we'll see where the rest of this plays out on the lockdown and how we're going to hash it out. But when we get to the business part of it, I'd like to readdress some things and maybe there's some answers on some of that, like the law enforcement. I know they're having a hard time keeping up right now with trying to keep, there is no enforcement of the shelter in place. So I guess that's probably the first thing that needs addressed. If we can't enforce the curfew and shelter in place now, how are we going to enforce the lockdown? That's just a few questions and concerns I have at this time. And I see Mary's back on too. I think she was on to something kind of good there with the food vouchers. But anyway, thank you.
Chairwoman Tobacco from Wakbumni, are you there?
I am here.
Okay, the councilman from Medicine Root, Councilman Wilson, was yielding his time to you. You have the floor.
Thank you, Councilman Wilson. I'm here. I apologize because I probably cussed under my breath, and we just have so much people that need our help right now. So that's what we're here to do. And I apologize if I offended anybody. So we don't have, I feel like we don't have time for doing all of this triage and trying to find out if people get EBT and food stamps. Well, our experience is that this time of the month, everybody needs help to get food to the end of the month. And so the food program we were talking about is that we could just allow a certain amount for people in each district per household. And we went through this with all the chairs last night, and they gave us an idea of how many households in each of their districts. And the districts, if we could cut checks to our household members. And then if we spread it out, if you call the lockdown Thursday, Friday, Saturday, we would be supporting all the districts' lockdowns as well. You just give them a check, let the people decide what food they're gonna need. And people don't want to get sick, so let's support them, give them resources to stay home, to get food for their families, get formula for their babies. And I think it could work. We just have to trust people. We just have to trust people that they're going to buy what they need. And right now, like with Wakbumni District, we have a lot of people working, and then we have to kind of quarantine people, and we have to keep people home because even our workers are testing positive. We're following the guidance, and so we hear that people are there's not a big labor force, but I think if we could agree to that, just let the people get enough to get through the lockdown and trust that they're going to buy the things that they need. Whenever I get lists from our people in quarantine and positive, it ranges all kinds of needs, and for us to try to fill one food box and make one uniform to fit for, how many on our res?
Chairwoman Tobacco, are you there?
I am. Am I unmuted again?
We can hear you, Mary.
Thank you. So that's the plan that we would propose if in this immediate lockdown right now, because it's just like a dream to be able to shop for everybody, but the reality is we have a lot of people that are in quarantine, and let's let them make their own choices. So the passes too, those are important. We have our construction crews going around doing the home repairs, because a lot of people don't have heat right now and electricity, and they don't have homes, so those passes are going to be important for, I think Tina mentioned that earlier, the day labor construction. So that's what I want to say, is that let's trust the people to buy their own food. And I know the districts could. I sent the email with our resolution from the Wakpami district to Jennifer this morning, and we met with the Crazy Horse Planning Commission last night, and all of the chairs like the idea. So this is how we could run it. We buy the number of households, we give them the money that they need, and we give them the money that they need. It doesn't have to be outrageous. We estimate at $300 per household. Use the utility application that's on file at Energy Assistance. The districts could cut the checks pretty quickly, and then we just reimburse the districts for that. I know you. For Wapamni District, we got $2.5 million to respond to the coronavirus, and we've been doing that. So we're hoping that the tribe could take care of that expense to get food to families for the lockdown, and then just let them shop. Let people go to the store of their choice and buy the things that they need. And because Bowie's has been great, but we can't expect to spend that much money at one store. So that's my plea to the tribal council, is to have the lockdown first, consider breathing emergencies, because there's going to be a lot of those when people are in quarantine and people are right now isolating. They're going to have a breathing emergency, so they're going to be coming out of their houses and they're going to be calling for help. So consider that during this lockdown, and then consider the food, giving food assistance, emergency food assistance during this time. We support all of that, and I really want to apologize again for cussing under my breath. I know we're all under a little bit of stress. So thank you, Chauncey, for yielding the floor.
Thank you, Chairwoman. I do have, yes, Councilman Yellowhawk, you are next. You have the floor.
Okay, yes, thank you. My main concern is that, a lot of the issues are passes, and then our location. You mentioned the store for shopping at Martin and Bowie's and White Clay. However, there's nothing addressing our Eagle Nest folks with the Wobbly Mart and the business surrounding our area. Mainly, a lot of our residents are also renters and farmers who move about in order to make a living. And at this time, there's a lot of activity regarding sales of cattle, harvesting, and so forth. I think the issuance of permits should be with our district chair locally, rather than going to Pine Ridge for everything. The task force that should be delegated to our district chair, which would be a lot bit easier than going back and forth to Pine Ridge, where the task force is located. And we've always been left out in all these things, and we need to make it easier for our people out here in our district. That's what I want to say, that we need to take care of our people out here also. And also the funerals. We have a couple of funerals coming up within our district. How is the task force going to comment on that. I want to comment on the task force regarding the funerals. Also, all the doctors. I read the plan, and it said if you would, there's nothing saying you shall. So that leaves up to our people to either change their appointments or keep their appointments if they wish. I know it's important for medical appointments to be kept, so that's my comment from my area. And let's decide, are we going to have a lockdown or not? That's the whole question that we're facing right now. I think I need to hear comments from regarding funerals from the task force. Brianne?
Yes, sir. So there, from the get-go of this state of emergency that we've been under since March, we did develop a protocol with Sioux Funeral Home in terms of how the services can be conducted, and it is recommended that the families follow that protocol. So passes will be allowed for the immediate family, and we will add pallbearers to that. And the protocol is the Sioux Funeral Home reviews the protocol with each family whenever there's a funeral. So they've had that since the beginning of this whole thing. So that the recommendation would be to continue to follow that protocol. And then the passes would be for immediate family and pallbearers only.
Councilman Yellowhawk, did that answer your question?
Yes, thank you.
Thank you, Madam Secretary. Who do I have next after Councilman Yellowhawk?
You have Lydia, then Nakina, Jackie, Mary is back on, and Ryan.
Okay, Councilwoman Beartiller.
Okay, thank you. I'd like to say good morning to everybody. And I guess another essential that we should put on her is our rural water workers. Sometimes the water goes off and we need them to get moving to get the water back on. So they should be on the essential list. And then the other concern is 3 weeks ago where we were working, or the task force has been working on this plan, and the districts all took action to get ready for the lockdown, and they approved a 7-day lockdown already. And the districts were given all the CARES Act money. Know who, I guess, the members of their district that will need help. And I think it's the people with the fixed income, which should be the list for them. I think the passes that they're talking about, I don't know, this 407-1223 number, I've been calling it all morning. There's no answer. So I think maybe they should put maybe 2 lines in these contact places. And I know that the president informed us that he's going to be the incident command post. So a lot of those numbers should be posted out publicly. And, we're going to be going through every concern or every comment that people have. And that always comes up. And we understand that. But if we have these contact numbers, I think as council reps, as directors, we could filter the people to the right direction or call in for them and make sure that their name is on for whatever their need is. I think that this is going to be an all day thing, and it's going to just water itself down again. And what our intent was to slow the movement and to try to catch up on the contact tracing numbers. And so, but everything is coming up again. And I think some of these can be worked out if it's going to be within 48-hour notice. I think the sooner the better. We need to move this lockdown. And I know that the task force has worked on, and we requested a lot of stuff given to them to put in place, and that's what they're bringing forward. I think we need to just move on what they're bringing forward and work with the needs that the people, the names are. Every task force and every district needs to set up a command post too. And our district people can call just that. The CAP office, our workers at the CAP office can be involved to get a lot of these needs that the people are texting the council for. But that's what I'd like to bring up, is to make sure that rural water is in that essential. And all emergencies, like the president said, he has the incident command post. So your numbers need to be public. I don't know how much lines you have in your president's office, but those can be, if they can be public, people can call. And then the work that I'm sure that the districts agreed to use their day labor, that's out of the CARES Act money. And the day labor, if the districts put that task force together, and the task force and the day laborers, I'm sure they could work on the district's needs. And so I don't know if we're just going to sit here and listen to every comment that comes in from the people, but it's going to get watered down. And I think we need to keep the focus on the presentation from the task force and work out the other details with them after, we pass the lockdown. And I think there was a lot of notice out there. And so I'm just sitting here listening to every comment coming through again. And I just hope that we don't water everything down. Thank you.
Thank you, Councilwoman Bearkiller. And with the numbers, that's what I'm working on, and I'm going to sit down with the PIO and Miss Eagle for the tribe's website to get those numbers, because we have 4 phone lines in my office, so we'll get those numbers out there. And then secondary, my staff has cell phones. We'll use those if those lines become overwhelmed. But and then my office will consolidate all the information on who's responsible for what, whether it be a transport or food or things like that, so we can ensure, and then we're not overwhelming like that. For Miss Red Bear, for food, we're not overwhelming her cell phone line with orders. We can process those through my office and, get her over a list so she can deal with them in a strategic manner. So we are working on that. And we'll get those out as soon as this meeting's over. Let's see. Councilwoman Mills?
Yes, thank you, Chair. And I agree with Lydia. We're here. I mean, there's all these different components, and another day, not doing something is another day of 60 some positives, with each one of those having over 20 some contacts, which leads to over 1,000 people we're trying to track here. So I think the question I have is regarding the lockdown ordinance, and approval of that today is what we need to decide today on. My question, I have several questions. The fine in the lockdown ordinance is $250. For me, I think the reason why why people are just kind of being lax about it is the whole fine piece. And we hear it from the enforcement side, when they stop people and fine people, that fine is nothing. I mean, I've seen fines from Rosebud, from Navajo Nation, like $1,000. So I think that is what we as a council need to decide, is that fine and what we want to stick to. And then the other, I've been wanting to see data. That's something I do participate with the task force, and I do see the data they share there, but I think seeing more data in regards to the public, this is the age group, male, females, people that are doing this, people that are out doing that. I think those are things that we need to be seeing, because people are just not seeing the seriousness of a pandemic. And then all these other components play into that. So I think the fine is something we need to decide as a council on if we're going to keep that at that low of a fine. And then the food voucher issue that Mary is discussing and talk about, I think that is definitely a great idea going forward. I don't know how that can be done so that we can try and get everybody assistance by next week, but I'm gonna say right now, if people aren't staying home, this isn't gonna be our first lockdown. There's gonna be more lockdowns if we can't keep our numbers manageable as a tribe, and the task force, the resource, emergency management, all those front line, IHS and their capacity. That's something I don't know if Sarah is on, but I think the public need to hear, the tribal capacity in our quarantine sites, and then the IHS capacity. I know people have seen those tents going up there. And, I went out one time to go by the hospital, and I seen them, and my heart sank. I don't want to see that. We've seen elders that have already passed away, and the numbers, to hear how many we've lost already, that just doesn't sit well with me. So to me, that's why we need to move on this, and then just either motion to approve that lockdown ordinance, but the fines is what I want to get clarified, if we should up that. And if Sarah Jumping Eagle is on, I would really like to hear the IHS capacity, because I am concerned on their capacity, like staff wise. If that spread, well, not just there, but any of our frontline places where there's an outbreak, and if we're going to be able to maintain it. And that's why this lockdown is important too. So if Sarah is on, I'd like to hear from her. And if not, then I guess we'll, or maybe even the task force can share that capacity to the public. Thank you.
Dr. Jumping Eagle, do we have Dr. Jumping Eagle on the line? No, I do not see her. Ms. Redall, do you want to respond to the councilwoman's inquiry on data?
I can respond to some extent. We have been trying to get more data in terms of being able to break it down. I think that that's one of the things that several of us have asked for, but I think the problem lies within getting a person to do the data entry and then pulling it out in a way that we can review it. And we're not at that point yet. They are, the Public Health Authority is working with the contact tracers in developing the dashboard that they use for the daily updates. And so once the contact tracers start entering in the information that we're asking for, we should be able to start pulling up more of a breakdown of information on what's going on out there with the virus, but we're not there yet. We are working on it. The other piece regarding the IHS capacity, I can share that Dr. Jumping Eagle in the medical work group stated that they are preparing for increased COVID-19 beds. They had 14 COVID patients. They're kind of rearranging internally their inpatient capacity to treat COVID patients. They're also looking at utilizing the medical tents for flu clinics and testing and things that they don't, the type of services that they don't want to carry on inside the hospital. So that's what they're looking at the medical units for right now. They've also reached out to Stanford, and there was another organization for additional medical staff, and also looking at their equipment for ventilators and high flow oxygen. So they're preparing. The other thing is that they're finding that they have to send patients further away because Monument Health is not taking patients from IHS, and at times Sioux Falls isn't able to take them either. So they have sent some patients to Denver or the Denver area. And that's kind of the status where they're at right now, per her report yesterday. So she's on, so she can update you guys.
Yeah, thanks, Cindy, for sending me the meeting invite. So was there a question, I guess, or?
Dr. Jumping Eagle, the question was what's the status of the hospital right now? And so I just shared with them what you had reported to us as far as rearranging for increasing inpatient capacity, and then the use of the medical units and the reach out for additional staff.
Yeah, so we've been gradually having increasing patients with COVID presenting to the emergency department and being admitted to the inpatient unit. And then especially over the weekend, we transferred at least probably somewhere between 7 to 9 patients with COVID to higher levels of care. And I heard Ryan mention to Denver area was mainly where they're going because we're not able to transfer to Monument Health. But occasionally we've been able to send to Avera. And, we've been reaching out to Wyoming, Nebraska as well. We're shifting more of our staff from the outpatient areas to inpatient to help cover for the inpatient services. We have patients who are on high flow nasal cannula, which is a higher rate of oxygen than the regular nasal cannula oxygen. So that's to help them with their breathing. And we're in process of converting the inpatient unit to a full COVID ward, and then moving the non-COVID patients to another area of the hospital. That's to just focus our resources for COVID patients, but also to make sure everybody's on the same page for how they're using their PPE, and to also help preserve the PPE, the masks, gloves, gowns, etc. So we had, as I think I previously informed people, I had reached out to, we have a collaborative agreement with Stanford School of Medicine. They had come out here, I believe it was early September, no, maybe late August, and did some drills, reviewed our protocols. And I reached out to them for volunteers. They sent a request out to the Society for Critical Care Medicine, and we actually received a list of volunteers from Stanford and the Society for Critical Care Medicine. So we're continuing to work on increasing our resources here at the hospital. But we did go into incident command yesterday afternoon at 3 p.m. And as you said, we are working with Steve from Emergency Management to get more of the modular units set up.
Your mic muted.
What's that?
We can still
We can hear her.
So our goal with the 3 modular units that will be at the hospital, outside of the hospital right now, one will be to assist with the ED triage process, and then another side vaccines, and then another one to offer additional area for testing. The drive-through screening times have been expanded at Pine Ridge from 9 a.m. to 1 p.m. just because we've been getting such large volumes, and we still want to be able to offer that testing because we've seen that when we close the drive-through, then a lot of people are presenting to outpatient or ED just for testing. So we're looking at those sites to continue to offer the testing outside.
Chair, one follow-up question, please.
What, Councilwoman Mills?
Yes. How about my other concern is with your staff. Has there been any concerns regarding maintaining your staff? I know I heard a little bit on the task force meeting, but I asked these for public, so that they see the seriousness of why we need to be following the laws that are in place.
So we do have employees that have had to go home because of COVID or having COVID. And so there are some that are at home but that's with all, many of the programs.
But it's not, is it a concern, like the level of concern as a facility being able to maintain?
I think it's always a concern. I mean, right now we're able to maintain our services. Obviously, it does limit us because if we have more staff that are out, like right now we're looking at moving, requesting our outpatient staff to assist with inpatient and ED. If there's staff that are out because they're sick, then we have less reserves to call on right now. It's not at a point where we're
okay, thank you.
We're not overwhelmed right now, but we do have more contingency plans in place for that. And with the numbers that are going on in the community, I would expect that that may become an issue in the next, coming week or two.
Thank you.
Yeah.
Thank you, Dr. Jumping Eagle. Councilman Jumping Eagle.
Yeah, so just off of what Nakina said, I was looking at that ordinance, that lockdown ordinance, section 8, compliance. And, Rosebud's house order, they impose $1,000 fine, or it says a year in jail if they're out breaking that house order. So I think we need to strengthen them fines on that portion of it, and you guys, we this pandemic's been going on for 7-8 months. We had money to prepare, everything we've been doing, we should have been preparing for what's happening now. I think the time for all these questions and everything, it has passed. We should have been prepared, and we need to act now to try to slow these numbers because of everything that was said today. Our hospitals, and like Rianne said, there's people out there walking around positive who tested, they're positive, they didn't get their results back yet, and they're exposing others. So, I myself, I don't like to be locked down either, but if it's gonna help our emergency services and help in other areas, I'm all for it. Thank you.
Thank you, Councilman Jumping Eagle. Councilman Apple.
Yeah, I talked with some of our district people about this lockdown. I will go for it because they want me to vote for it, but my question is, why don't we look at the oh, she's up. I'm at a loss of words. The enforcement of this lockdown. The last one we had, it seemed like it made our youth say, no, we're not going to listen to anybody. And seemed like our partying took one step forward. Nobody was listening to it. They were inside their houses. Cops were patrolling, and they stayed inside their houses, but they were partying. They were gathering. This is where the COVID is coming from. How do we enforce that? We have to look at the enforcement. We make these fine laws without enforcement. The things that are being talked here are good, and if that's going to help slow down the COVID, I'm all for it. But are we really slowing it down? Are we looking at isolation of our people who got it? How do we know? Just Ryan just said that I don't know if we have it. We're walking around, and I was one of those. I was asymptomatic, and I didn't know I had it. I went home on a weekend, and Monday my daughter called me and said that she tested positive. And so from there, I just stayed home because I had probably had it. I didn't feel anything, but after that third day, it hit. And that's not something that anybody wants to go through. But we're all going through it because we're not getting enforcement. We talked to Robert Ecopy, and he said he doesn't have the manpower to enforce all these things that council wants. It's only on paper that we're doing this. So the actual enforcement is not there. And we're just wasting time by doing a lockdown that ain't enforced. So we got to look at the enforcement. And I want to know if the task force looked at or talked about enforcement for the lockdown. I'm concerned about our local store in Manderson, our Pinky store. She's losing a lot of money for her business because of lockdowns. The last lockdown, she lost quite a bit of money. We have to look at the business part of a lockdown. In every district, there's a store that's going to lose out. Are they going to close up because of the lockdown? There's a lot of things. I hope the task force discuss these things. The help that we need for the businesses all over the reservation. Where's the application that you can apply for the help that we done for the businesses? How are we helping these people? We're locking down everybody, and that's going to cause our youth to continue gathering even more so. And I've been griping about the bootleggers. Let's go after the bootleggers. And again, we don't have the manpower. I asked Cecilia, let's go after the bootleggers. And we don't have the manpower. I think we done ourselves in by having her put it down to 17% for employees when we used to have 84%. Then we could have had enforcement, but we're not. We're following HUD guidelines, and she put it down to 17%. So we don't have the manpower there. And I'm just, is this a waste of time? I'm wondering. Without enforcement, it is a waste of time. We're having our youth, our young people, fight against each other because of these things that are happening. You're supposed to be in your house, shelter in place. I don't have to be, that starts there, and possibly a fight. there's a lot of issues, social issues that the task force probably talked about. I don't know if they did or not. I didn't attend the meetings, but I'm hoping that they did, that all avenues to a lockdown were discussed and policies were put in place. I heard Rayanne talking, but there's a million things that they didn't discuss that happened, that actually happened. We're going with assumptions on our policies. You have to live right there in the district to know what's going on. You have to know your people, and that's why we get elected as council, to be a elected leader for these districts. So we know what's going on. We know who's bootlegging. We know who's meth dealing. We know these are causing gatherings. Are we going after them? That's what I'd like to know, if the committee went and discussed these things. No enforcement. There is no enforcement. We're wasting time, but I will vote for it because my people want me to vote for a lockdown. So, but those are my personal issues on that. Thank you.
Thank you, Councilman Apple. Councilman Gibbons.
Hello, people. Council, I'm going to put it in perspective a little bit. Mr. Greenwald warned us months ago this was coming. Nakina and myself said, let's get ready. Plan. Now we're late in the game, and it's tough, guys. We've got a lot of sick people, overwhelming everything. I just got a text from a patient at IHS that says it takes hours there's only 2 nurses on duty, and it takes hours to get help in her room. We're at that point, guys, where we have to do something. But I got a couple questions for Rayanne, right quick. In the lockdown ordinance, it doesn't say that you're going to declare ICS, and that's going to be crucial. The incident command system, that's crucial, just like IHS declared theirs. How many people, Rayanne, are trained in the ICS system right now on the task force?
I can't answer how many are trained. I know that on the incident command organizational chart, I believe all the section chiefs have went through that 101 training, online training. I don't know how many additional, but I think that, and I'm not sure, I'd have to go back and look, but when the president declared a state of emergency, we went into the incident command system when we adopted the amendment to the emergency operations manual with the response for the infectious disease portion, and implemented the response plan. So we've been under an incident command system from the get-go. It's just that we are kind of working hand in hand because several of the task force members also sit on the incident command. So it's kind of an incident command system / task force. So that's how we've been operating. I think just looking where we're at right now is implementing the phase 3 at a full lockdown is as much as feasible. So that's my response to that. And I would like to respond a little bit to what Mr. Yellowhawk was saying about enforcement. And we recognize the lack of services for enforcement, and it's no fault of public safety's at all. But the reality is we have to do something right now. And we have districts who have security/foot patrol who can help with, having people go home if they're trying to come outside or out wandering around. But they would work hand in hand with public safety. And I believe that they have done that with when some of the districts have done their own lockdowns. So we understand the limitations of public safety. So we would rely heavily on our security and foot patrol to help in that effort.
Okay, thank you for answering his question on my time. That's we know that the law enforcement piece is not a player in this. It's a disease. They've got a certain number of people out, and we as a community, we as districts, we as a reservation have failed in keeping our people home, staying home. I'm sure those softball tournaments in Rapid City sound really important right now. I tell you what, if we would have followed our ordinances from the get-go, we would not be here talking about a lockdown. We got a law enforcement. They've got families. A law enforcement officer's main goal is to get back home to their family safely, not to go home and infect their family. I want to talk about the medical passes. We have many people who go to the VA and to Rapid City, and they do it on their own. They don't announce it to anybody, but all of those people who are being responsible and getting to their appointments, now we got to get permission from a CAP office who shouldn't even be working anyway. And most of it, all it takes is one exposure and our CAP offices are shut down. Several people mentioned it earlier about having several lines open, at least to say, okay, hold on or do something, because people are going to get very tired, and they're tired already. I've been hearing it about sending in applications after application after application and nothing. I'm tired of it. The passes, you mentioned color codes. What color code is our security? Wounded Knee has done a wonderful thing with their foot patrol and on quarantine houses, and it has to happen. It's a must. Hats off to Wounded Knee District. But what is the color code going to be for our foot patrol in the Wounded Knee District? Has that been determined?
Is John on? John from Emergency Management. He will be. So what we have is a credentialing machine that will be utilized, and it will be color coded for the various entities that need to be given a pass. So there'll be color codes for medical passes. There will be color codes for security. There'll be color codes for critical workers. So that's John can go into detail about that, but it will be a plastic card that will be issued, and it will have everything labeled on there so that law enforcement, security, and border monitoring can identify the individual based on that pass.
Okay. Well, the reason I mention that is because there's so many different exemptions to the lockdown, and I didn't know if we had enough colors, but when we get to, I want to go back to ICS training. Without that training, we end up in chaos. I mean, there's been, I think Lydia mentioned that president's going to be the incident commander. Well, we went through some flooding and some fires and all kinds of good stuff. And that training is crucial. And I don't think anybody should be an incident commander without the level of training that it takes to be an incident commander. It just adds to chaos. And if you know the ICS system, You know that 1, 2, and 700 are a gimme. Then you got 3 and 400, and the finances is what, 6, 800. All of these divisions are you call them section chiefs. They got to know what they're doing, or we're going to end up in chaos again. And you know, that ICS training is crucial. There's quite a few problems with this plan, and I'm sure, like Lydia said, we're going to be sitting here for a while today. But I'd like to know that the people who are in charge are at least trained to be that. Thank you. That's all I have for now.
Thank you, Councilman Gibbons. And some clarification, I did not say I was going to be the incident commander. I said it was going to be a command center where phone lines will be operational 24/7 for our people to be able to call to get answers, to notify that they need some sort of assistance, whether it be food or COVID related. That is what was stated that my office was going to perform. Emergency Manager Wilson, I guess, can you respond in reference to the councilman's inquiries on incident command and training for your incident command staff?
Sure. Good morning, Steve Wilson, Emergency Management. For our office, it's a requirement to have the training coming in here. Whether it be ICS 100s, 200, 300s, 400s, 7 or 8s, and then specialized training for planning and for response. So, with that said, it doesn't do us any good just for us to understand that. We have to look at implementing the training within our government and our supporting programs to understand that, whether it be our critical programs or our first responders, to be able to be on the same wavelength with everything. So, for our office, yes, we do have that training. And like President Barrett understated, they're looking at being that call center to help field those calls and more or less kind of a dispatch for information going out to the public and kind of streamline that info that needs to go out to everybody.
So, Mr. Wilson, can you tell me how many people are on the task force that are ICS trained?
Yeah, our section chiefs are trained for our logistics, for our response. We have a chief of staff who's sitting in for the financial portion of that thing as well. For the basics, even for our volunteers and also for our day labor is a requirement for them to have at least the ICS 100 that teaches them the basics of how all of this works together.
Thank you. 100 and 200 and 700 go together. Why didn't they complete 200 and 700?
A lot of them do. It's a continuing education for everybody. There is a computer-based requirements for timing that they have to do. There's also classroom time. As you guys know right now, the classroom time is kind of tough to do, but we're working through that. So it's always continuing. And anybody that comes in to help us under these types of emergencies, our planning coordination individual is staying on top of that, making sure that they get that training and continuing.
Mr. Wilson, I understand that you've been doing a hell of a job. I know Shawnee, John, you guys have been doing way far and beyond of what's required of you. I know that, but we've had troubles, keeping up with the quarantine people, and we don't have enough volunteers. But how are we going to keep up with, like the guy said, going 300 to 400 and going from 400 to 1,000? You got a plan, guy?
Yeah, and we're working with the districts the best that we can to do this. I mean, it can't just be us. We're getting taxed with a lot of different operations right now, and it's putting the hurting on us. So I mean, I think we gotta stop the round and round table kind of stuff and come to some real action. I think that's gonna be between us, the districts, and our government to step up to this thing. It's unfortunately it can't just be a few answering to this increase.
Very, very well said. Very well said. And you forgot the most important component of it all, Mr. Wilson. The people, the community, the people need to act responsibly. They need to shelter in place. They need to stay. We need to keep our butts home and let this virus work itself out. The people are going to be the ones, not law enforcement, not emergency management. The people are going to stop this virus. I mean, you can't argue with me on that one, guy.
No, I can't. And you're absolutely right. Is this an individual? If you break this down, it's an individual emergency. Everybody's got to do their part. Stay home.
Thank you, Ms.
Thank you. Hang in there, Mr. Wilson.
Thank you.
Thank you, Councilman Gibbons and Mr. Wilson. At this time, Councilman Greenwald.
Thank you, Chair. Yeah, I think it was all the discussion so far is making it a lot worse than it really needs to be. It boils down to what Glenn said. Glenn, you hit it right on the head there. We as members of the Oglala Sioux tribe need to do our part, and that means stay home. All of this chaos sounding stuff that we're talking about is chaos because we as tribal members make it that way. The only ones that should be traveling around are ones with medical emergencies and stuff like that. The rest of them should be law enforcement and your first responders. Everybody else, do your part and stay home. I'm going to stay home. My family's, my extended family, they're all going to stay home. This whole thing with the food, if you're going to start opening up and start buying everybody's food, then you're going to really have problems, Chancey, because people are going to start selling their EBT because they're going to want to get booze with their EBT. Not everybody, but there's a big portion of them that do use their EBT. They sell it and they go get their booze. And that's where you get your calls for service and your domestic abuse stuff going up. So as far as I know, the food service was only for the people that were in quarantine for the COVID stuff. You start opening it up to where you're starting to buy everybody groceries. I thought that's what our EBT and our commodity program was for. If we didn't have a shutdown this week, who would be buying their food? See, all of a sudden now you're trying to bring everybody into that, and that's going to create chaos. The people that have EBT and that get commodities, they need to plan and pick them up. They need to shop for their stuff. And then the food is for the emergency COVID quarantines. I think you make it way more chaotic when we start expanding things, But I think we all do our part because our district is ready. I talked to several other district chairs, and they sound like they're all ready for the shutdown. But the only way to slow it down is if we all start doing our part. And I'm going to stay home because if I try to go out, I'm going to cause chaos. I'm going to get stopped by the cops. I'll probably get a ticket, stuff like that. So to avoid the chaos, stay home, plan for this. It's only 1 week. Let's do our parts, people. Thank you.
Thank you, Councilman Greenwald. Councilman Little White Man.
Okay, yeah, my whole thing was enforcement. How are we going to enforce? And yeah, we could sit here and say, "Oh, well, I'm going to do my part. I'm going to stay home and everything," But this virus is still going to be transferred because not everybody listens to what they're told. That's the truth. It's hard to believe that people don't listen to us. But it's the truth, though, So we got to think about, if we're going to really do this, we got to think about enforcing. If the police department is understaffed and not enough manpower, we need to bring in some people, hire some people. Right now, Kyle has security and they're watching positive houses, right? Well, we need to, if we can keep that up somehow, I don't know, pay out some more cash and hire these security guards to help the law enforcement out. Something, because if this is going to be for real, we got to enforce hard. Thank you.
Thank you, Councilman Little White Man. Superintendent Long.
Good afternoon. I just had a couple points I wanted to make sure that we put out there. And I just spoke with Lydia offline on the general assistance for one. So the first one is that according to CFR, these assistants, if you're going to consider giving payments to the tribal members, they're considered in-kind payments, so it will have to be reported on the general assistance. So it will affect them at some point in being able to receive general assistance if the tribe decides to go the route of handing out money. I've also put on the group chat the CARES Act guidance, just as a reminder. I know I shared it with you folks a few months ago, but also provides guidance on how the money can be spent, if that's the route you folks want to go. The other issue that's brought up, and I've got a couple of texts on it, and I see Mr. Janice is on the Zoom. I understand Pine Ridge Village is issuing a lockdown. I had some concerns, and also from the businesses as far as, are they going to wait for the tribal council to act, or is this in place? But I know there was some discussion earlier on the council meeting and who's going to make that determination on what's deemed a critical health issue. And I think Mr. Wilson might have brought it up, if I remember right. Because, yes, cancer and the dialysis are givens, I think, but I don't think it should be up to an individual or a village to determine what type of medical assistance an individual needs and whether or not it's important. Obviously, if you make an appointment to see a doctor in Rapid City or Scottsbluff or wherever, I think you pretty much consider it as an important issue that you want to address. The other one, and I've kind of had a conversation offline, is for me, and this is totally up to the tribe. I'll support whatever you folks want to do, but I just don't see a 7-day lockdown as doing anything or even being effective. With the amount of time it's going to take to implement, to get folks on board, 7-day probably isn't going to do much. But then on the other side of that coin, we have tribal elections on the 3rd. So it's going to be, I guess, do you do a 7 or we do something up to tribal elections? But then you have to consider giving the election office the time to get prepared for the elections and be able to get out to the districts. So I just wanted to make sure that was some thought that was being put out there, because I'm also getting the live Facebook notices and some of the comments. I think a large portion is the folks just want an answer. Are we going to lock down or are we not? Thank you.
Thank you, Superintendent Long. Madam Attorney Berrygold.
Yes, thank you. I just want to point out a couple of items if the tribe decides to move forward in adopting this lockdown ordinance. I have prepared 2 additional resolutions to go along with it. If you adopt this lockdown ordinance, what this does is establishes a framework for declaring a lockdown. The ordinance itself does not declare a lockdown. Okay, so just be aware that this ordinance alone does not declare a lockdown. What it does is gives you the guidance for what that would look like in accordance with, and does require there to be a lockdown plan. If you do adopt this today and you do want to declare a lockdown, I did prepare a resolution, a tribal council resolution, declaring a lockdown. And of course, the dates are blank. It's up to you on when and for how long that would be. If you adopt this today, the earliest, per this ordinance, the earliest you could declare a lockdown is whatever that time frame is for notice. There was some discussion about that being 48 hours. If that's the case, you adopt it today, you would still need to adopt a resolution declaring the lockdown. It couldn't go into effect until 48 hours, at least 48 hours from now. Of course, you certainly could provide more notice than that, but that would be the minimum. The second the second resolution that I have prepared is in section 7B of this ordinance, it does have a provision allowing the council, if it chooses, to delegate the authority to declare lockdown to the executive board, because a lockdown is declared through tribal council resolution. Without delegating that authority to the executive board, you need to have a council meeting to vote on a resolution. So I did prepare a resolution, if you want, delegating that authority to the executive board. The way I drafted it is I thought that maybe during the month of November 2020, you'd want to delegate that authority to the executive board to take care of that time frame in between the general, basically in between the general election and then swearing in the new council. So I do have that and some other limitations if that's a step that you'd like to take. But I do want to remind you that this is going to be, if there is to be a lockdown, this is going to be a multi-step process today. One would be enacting the ordinance, and then two would be actually declaring it via resolution. Thank you.
Thank you, Madam Attorney Barrigal. Dr. Sarah Jumping Eagle.
Just to address the questions of what the task force had discussed, many different potential avenues, and also looking at what other communities have done. For example, Navajo Nation, when they were going through their surge and they're continuing to deal with high rates of COVID-19. I think, we all realize that, we're kind of behind the 8 ball now. The task force had recommended the lockdown 2 weeks ago. Now we're in a position where we're continuing to watch the COVID-19 cases increase. And although the hospital right now is functioning, if we continue at these increasing rates of COVID-19, we are going to have to limit services. We're going to be limiting outpatient services because we're having to shift our services to focus on the inpatient unit. We're flying people all over the place right now because now we're seeing not only the COVID people coming in, but we know that maybe a week or two after they have COVID, some people will start to come in severe respiratory distress. You're going to start getting people in the community who live, in very rural areas who are presenting in respiratory distress and calling 911. We're 1 or 2 people away from our ambulance system not being able to respond to some of those calls sometimes. Our reliance on air transport, our emergency transports, that's not going to help you out in the middle of Red Shirt or out in the middle of Yellow Bear. So, I think we have to move to action, and we need the tribe to be an emergency management response. We need to pull in all resources, and we need to decrease the rates that are going on right now. It's not going to stop all of the COVID cases, but our hope is that we'll prevent more deaths in the community. So I encourage the tribal council and everyone to take action. Yes, it's not a perfect plan. We recognize the limitations that every department has, that IHS has, that the police force has. But it's going to take, as we see what the districts are doing, it's going to take the districts, tribal council, emergency management, our community members, our Akichita, all working together. So now's the time that we need everyone to not think about how it's not going to work. How are we going to make it work? And how are we going to take action to take public health measures for the community? We're still going to have people who will not follow that, and they're going to continue to place our first responders at risk, our hospital at risk. But now we need to figure out how to take action, not continue to talk about how to do nothing.
Thank you. I'll go to Madam Chief of Staff.
Okay. So
Just real quick, I mean, we were listening, taking notes and different things like that, but I just really wanted to emphasize. I know there are a lot of concerns saying that we don't have enough time. Either way, if we do a lockdown, we don't have the resources. Resources is what I'm hearing. But if we don't do a lockdown, we don't have the resources for that either. I'm all about saving lives and making sure that in the future, long term, the more that this virus grows, the more that it spreads, the more that of our people, it's not just about life or death, it's the quality of life as well. Because the more people that catch this virus, the more heart problems, lung problems, medical issues, long term that they're going to have. So we have some of our very some very own people that work for the tribe who have had this experience, and I've heard it numerous times, over and over and over. This is not something to mess around with, and it is not. It's not anything to mess around with. It could change your life forever. Or it has the power to take it. So a lot of these different things that are coming up as concerns. I mean, I'm not going to waste everybody's time by going through each and every one, but this has been a progress. This has been a process making this happen. This just didn't come this weekend and we decided to do this, or last week or last month. This has been a process starting way back in the spring. And when the decision was made by the districts that they pretty much had enough and that they wanted to protect their people, when we met with them, I was like, okay, we got to start with the end. Where do we be by time Thursday comes, and different things like that. So we've started, and they have started. They've already have things in motion. They are preparing to take care of their community members, but on a tribal level. That's where we need tribal council to kick in so we can help support that. No, we're not going to be able to get food out to everyone. That's a given, but for those that will take care of themselves, like John just mentioned, the VA or the GA checks, they should start receiving them today. We also know that childcare is kicking in and trying to help out their families. They're going to be distributing checks to their families. Commodity distribution is ready for those that are over that income this week, and they are prepared to go out and deliver pre-certified food out to individuals next week. Even though next week should technically be their inventory, they're ready to kick in their part, and elderly males is ready to kick in. The schools are ready to kick in with feeding their students. They're going to prepare 5 days worth of the breakfast and lunches, and they're going to get that out to their communities. So there's several different layers to this. There already, since the task force and the incident command has kicked in, they're already ready. We do have One Spirit running strong, and a few other 501c3s, which in the Lake Creek district and that surrounding area are ready and ready to help out. One Spirit has requested that they
address the dire need for the critical families that, even though we have all these safeguards in place, that they are going to come in and say somebody didn't get a distribution, somebody didn't get, wasn't able to prepare, whatever the reason may be, because maybe that they're willing to kick that in when called upon. So those things are already in place. I know there's concern with enforcement, but if we lock this down, that gives the police, the DPS and the foot patrols and everything else that these district, I don't know if they're called committees, the executive committees have already put in place. If we are to lock it down, then they have their plans within their community on how they are going to address that, address it. And this lockdown is to support that enforcement. Each one of these different programs have an idea. So if they're not having to respond to trafficking the road down here and having to chase down anybody who's speeding, or these things that can be avoided if you're locked down and at home, the focus can be more on making sure that people who are under presidential quarantine order, that can be enforced. If we're locked down, nobody's going to go down to Nebraska or Rapid City and go get booze and different things like that. So they would have that opportunity to focus on ensuring that everybody's home, and not saying that everybody is going to need that, because obviously they don't. There's a lot of us that will listen and follow this lockdown. So we really need to focus on it, limit the movement, so that our contact tracers can catch up with everything that we got going on. We can make make sure everything is in place for those that need it. And I think it's a really, really good plan. It's already been set in motion on the district level. And I feel that as the tribe, we really need to help not only with the financial part of helping take care of our people, because if you look at those numbers that were submitted for that budget, it is not going to feed everybody on our reservation. I know there's a concern regarding that's a four-person family, but it isn't intended in that way to cover everybody, because when we start, these are people who, number one, maybe they don't get food stamps, they don't get commodities, they don't get GA, and maybe they're not working, and some of us do work from paycheck to paycheck. But being able to help those individuals along the way. And so it's not going to cover everything, but the districts do have their plans in place. Some of them are going to provide food to every single one of their homes within their districts. But there's those communities that are larger that are not going to be able to do that, and maybe somewhere they've been missed. And so the tribe is going to help with that. So that's all I wanted to share, is that this is in motion already, especially at a district level.
Thank you, Madam Chief of Staff. Councilwoman Sears.
Yes, thank you, Chair. I do have a district member that's been waiting, and she's wanting to talk, and I'd like to yield the floor to Holly Wilson. Are you on there, Holly? Hello?
Can you hear me?
Yeah, we can hear you.
Can you hear me? Okay.
Yes.
Thank you, Jackie. My name is Holly Wilson. I'm a member of the Wakpamani District. I'm elder. I'm a grandma. I have a big extended family. I sat here and listened today, and it's upsetting because, yeah, there's some good talk, and there's some crazy far way out talk. You talked about contact tracing. I myself witnessed this week and last week. You go through the line at IHS, the drive-through line from 9:30 to 11:30, get tested. They hand you a few papers. There's no number where to call to find out where your test result is. But if you're smart enough and you're really concerned about it, you're going to make a call somewhere. I called the laboratory. The laboratory says no. Call back IHS and press number 1 and get the COVID hotline. So I done that. Test on a test that we done. There's another flu going around. I'm surprised IHS director up there ain't telling the people that. It's much like COVID. You get all of the fever, the chills, the headache, the vomiting, everything, and it's not COVID. And they're not telling us people that. But for me and a grandkid, we went up and we tested, and we did find out yesterday we were negative. I have a friend in Pine Ridge Village that tested positive from ER. She went home. Nobody's contacted her from any organization. And you people know I've called. I've called CHRs. I've called emergency management. I've called all over to try to get her. Where's the paperwork? This person needs to be identified. She may need a light bill paid. She may need propane right now or some groceries. Something. She's got to be there the whole time she's sick. Her family's got to be quarantined.
Please hang up and dial 911. All down power lines should be treated as live and dangerous.
Are you there? Hello?
Yes, we can hear you.
Okay. So anyway, that person now is still dealing with not getting any services at all in Pine Ridge Village. So Mr. Greenwald talked about, nobody should get help. Who are you to say this when you have people in your own district that can't get any services? Do you know that Pine Ridge Village isn't helping with anything? And you know how I know? Because I called about another case. This little grandson, a distant relative of mine, it's my sister's grandson. His grandpa and grandma live in Pine Ridge. They went to Sioux Falls 8 days ago for a doctor's appointment. They asked me to watch the grandkid for a couple of days till the dad got out of the hospital. He was in Sioux Falls, so I did. Dad gets home, we give the baby to dad, and then I called the grandparents and say, well, are you going to take the baby back now? And they said, no, we're both positive. COVID-19, and we have to be quarantined until we're in 14 days or until we're well. Okay, so this little boy who has no income other than what his grandparents get was placed with his dad. I said, he's got to keep him. He's got to help. I've got grandkids at home too. So we've been doing food, trying, because he gets one issue of commodities. One. He gets 2 hamburgers, either a roast beef or a pack of 4 pork chops for the month. So we've been feeding, and family's been taking to this little guy. Kids like snacks. They like an orange. They like an apple. You know, it ain't all about just what you get in your little box. You try to share. We are Lakota. I don't know where we lost that. Somewhere along the line. This compassion is just not there anymore. Mr. Long said we don't need the lockdown. Well, I don't know if we do either. But if you play golf in your backyard. And Shicha, Greenwald, his name's Richard. But now I know why they named him Shicha, because that was a Shicha thing to say. Across this reservation, we're hurting. I'm not the only family out here. There's several grandparents that have takujas, and the first place your family goes is to those grandparents' home. We need help. We need this. We need that. We need Clorox. We need tissue. Tissue. Oh, yeah, right. We're going to spread it all over. And we do. We do that as grandparents, as Lakota people. I don't even think Pine Ridge Village should have been put in that constitution, or was it ever? It shouldn't be recognized as a village. It should be Wakpamani. And they should have 6 council members altogether. That really upset me. And it kind of put me on a wrong track here today because I didn't want to call and be mean and ornery. But I want to tell you, we live in the trenches out here. Us Lakota people. 2 weeks ago, we had impoundments. We're still doing regular business with the tribe against tribal members. 406 head of cattle was taken from a tribal member. He had a check. He couldn't find nobody because one guy was sick with COVID. There's no one at the tribe to accept the check, so he went home. Now to combine out, this last week they sold his cattle. Where's the recourse there? Why didn't the tribe buy his cattle? Butcher all 406 and pass off the meat. No, a white guy from Rapid came and bought him. I mean, we're not doing anybody any good when we fight one another. And with this COVID, I hear a lot of red tape, paperwork, red tape. If there's a person, a family positive, put a big plus sign at their gate or their road, at their house, so people know don't go there. Don't bring it back. Now, IHS is another thing. I'm going to tell you this, and this is the truth. That lady got up and talked, that director, that's fine and dandy. She ain't telling you. In ER, the other night, there was 15 people positive. The housekeeping transported people that needed to go to Rapid. Housekeeping did. The workers that go in and clean the area that this person's in supposed to be vacated for 1 hour because it's airborne. Then housekeeping goes in, cleans it for the next person. They weren't following that protocol because that staff in ER wanted to move. So, talk about a breeding place? That was right in ER. How many people got infected? Who knows? You weren't even infected while you were there. You're damn sure going to be infected when you leave. There needs to be an alleyway up there, especially separated just for our COVID people. We got a lot of people with hypertension, high blood pressure, diabetes, refills of medications. Are you going to give them people a pass? Or can we simply call IHS and say, hey, we need a refill? Oh, no, you got to see a doctor because your high blood pressure pills is outdated now. All right, then there should be a safe place for this person that ain't sick to go to. And you know, I'm really supporting our district chair for getting up, and she does a lot of work. Her and I were on the wrong side of the fence for a long time. But I apologized to her. I told her I'm sorry. I'm ornery and I'm old, and I have my own ways. But I agree. She tried, and she tried to get a hold of everybody else, the district chair people, to try to work something out during this lockdown. It's the end of the month, and people that are on a fixed income, you have a hard time. Hard time. Yeah, your money's depleted. You paid your bills. But you still have extended family that needs help. You know that you do. And you ain't going to just sit there. Hell no. I'll make bread if the kids don't have bread. If we don't have flour, we'll borrow flour from somebody. You know? That's the Lakota way. But I just cannot believe that we're going to sit here and rhetoric and talk BS all over and over. Now, another thing, this election that was held, you had a training. Many people were infected, or at least exposed, maybe not infected, exposed. Okay, then they put the tellers and the judges into quarantine. So, I have 3 Talcosas that's quarantined in Pine Ridge. They're not positive or nothing. They didn't even test, really. They're not sick. But they needed help. Who should help? Wakpamani, because Pine Ridge Village wasn't doing anything. And because they're our members, our district chair did. So I want to thank her, Mary T., for getting up and for fighting for us Lakotas. And I give you a hand, girl, because you know what? Someone has to do it, and you are doing it. And I'm really thankful that Mr. Greenwell ain't my council member. I really am, because right now he should be putting his head down in shame for the comments he made. I see all these new vehicles. I see everything. You hear all these contracts that's going out. And that's another thing. Our applications that for this home repair for $3,000, put in always Zephyr's office for him to approve. Why should one person have that approval authority? Isn't it kind of dumb when you can't look at the scope of the contract and figure out what this money could be used for and what it can't be used for? And that's just a hold up. Cold weather's here. We're going to have 1 whole week of cold weather during this lockdown. So I hope you leaders think about that. So anyway, getting back to this election, the tellers, the judges got paid. Well, I got one daughter that worked in Oglala as a COVID worker, cleaner. Took ballots to the homes that were COVID positive. She got their votes, took them back. She still didn't get paid. Because you know why? The check's locked up at the election office. They can't redo another check. So how many days does she have to wait? And that's a presidential issue. I've been calling since Monday and Friday of last week. Still haven't gotten a response. Nobody called. Are you? Did you hear me, Mr. Chairman?
Yes, I did.
Okay, so I want to address that issue. She needs that check so she can buy food before the shutdown.
Okay,
So
well, let's get back on course. I will address that with the Election Commission and with the Finance Office as soon as this meeting's over. But we need to get back on track and we need to get back to the meeting.
Thank you. I'm going to thank you now, and I'm going to end my talk. And I'm going to ask you people to remember us. Remember the people that you are responsible for, that voted for you, that put you in there, that support you and depend on you. Because we, the people of this reservation, do. We depend on our tribal government and all you officials that do your jobs. But try to get rid of the red tape business and try to get something done. So we know. Keep us on the same page. Let us know if we have to call dispatch before we drive somewhere or go to the hospital or do something, that we're not going to get a big fat ticket, that we'll be getting a waiver or something so that we don't have to pay that. Because there's people out there, believe me, that ain't going to know. So spread that and communicate to one another. Get it out there. Don't let these people fall through the cracks. And that's all I ask of you. Thank you.
Thank you, Ms. Wilson. Councilwoman Merdanian?
Thank you.
Chairman, this is Philip at some point in time.
Yeah, I think we need to move forward with the first action, and that's the ordinance. And so I believe there's a motion, and so we can get moving forward in regards to this meeting and actions that need to be taken. Thank you.
Thank you, Councilwoman Merdanian. Councilman Goodcrow.
Thank you. I had my hand up way back, but you know, nevertheless, I'm here now. One of the things that I wanted to bring out, and there's several phone calls that I received yesterday and Texas just regarding our lockdown, and like I can't remember who was saying that, you know, it's damn if you do, damn if you don't. But again, we're in this for the sake of our people, and so we're doing it on behalf of Oyate, who some of them realize that the situation at hand is getting way out of hand, and so we need to address the issues of this lockdown and move forward in that direction. But the bottom line here is that whenever Rayanne was reading, and we talked about businesses and across the reservation that's going to remain open on behalf of our people, our locals. That's Porcupine, Ellen, Kyle, Manderson, Pinky's, and they have a store in Porcupine, Pinky's, and these other small stores in Oglala and so forth that serve our people, but they need to all remain open. There may be some districts that may try to not keep that particular store open, but like we're trying to keep locked down and utilize the locals. So I just, whenever that language that what Rayanne read on as far as businesses, that would imply that all businesses across the reservation in each district. So I just wanted to make that clear. So I hope that maybe if Rayanne's listening, that portion, if that's agreeable on that, or That's the intention of that particular area. And the other thing is that Robin talked about our homeless and what some others talked about homeless and what we should do about our homeless. And then, but we have it's a pandemic, and some of them are hungry, and some of them are don't get 3 squares a day like the rest of us do. Maybe they get 1, maybe they get 2. In the evening when they go to Billy Mills, they're probably hungry and go to bed and wake up hungry and hope for the best during the daytime. And so, but I had a lady that called me regarding that, and she wanted me to address this issue regarding, and I also wanted to bring this forward too. So, but we have COVID dollars, the CARES Act dollars that should be utilized in that direction. I don't know how many other of the churches or whatnot that usually give dinners to our homeless out there, but maybe there is. I don't know. In Pine Ridge, I used to see some of them giving out stuff, and back to Billy Mills and so forth, and give out dinners. But I don't know if that's being done anymore. And I think the Oglala Sioux tribe should, make a stand and move forward in that direction as far as feeding our homeless. So, Lila Urshikov. So I just wanted to bring that forward and those 2 items. And Wopila, thank you very much, Mr. Chairman.
Thank you, Councilman Goodcrow. Councilwoman Little Hawk Weston.
Thank you, Mr. Chair. Just listening to a lot of the comments that are being discussed by the council, but also want to say that we have to listen to our district members that are getting online, are texting, are calling us right in the middle of this council meeting, addressing us with their concerns. So I just want to say that, but I do know that we do need to move forward on this lockdown. And like what Ms. Wilson said, those things need to be addressed by the task force in working with IHS, with a medical work group, looking at some of the concerns that she had. But also we need to understand that our people, some of them out there don't have income. And some of them, it's hard for them. But again, but with that, I'm going to make a motion to adopt or approve this lockdown, the ordinance, I guess the first one that Ms. Redall read, and to start the lockdown on Sunday at 6 a.m. and end it on Sunday, next Sunday at 6 p.m. That will be my motion, and that it sounds like everyone had a chance to say what they needed to say. And I think that the task force has a plan. They have a plan for the food distribution. They have a budget. They have things that are in place. So I'm going to say that we need to move forward on this now. Our numbers are rising, and I know some of our people are not happy about the lockdown, but we need to understand that this is for the safety of our people across the reservation. We got to do something today. And I think that's the reason why this special was called. So, we need to move forward now. And I think that we just need to take everything that we heard today into consideration when we're doing this, and to move forward, but to make sure that when we do this, everybody is going to work. I heard Miss through the group, the group chat here. Our CEO of IHS is suggesting that maybe we need to put some essential workers through the tribe back to work to help out with this effort. That's another thing maybe that needs to be looked at, but that has to be looked at by the chief of staff. The other thing that I'm getting text messages is we have people in our district, general public, that are willing to volunteer to step up and help with food distribution or help with whatever they need to do. So we have people out there that are asking that we can help out. Where do we go? Where can we go to help with this effort? So I want to let people know, the council, that our people out there are willing to do that. I think us as council, we need to do that effort too. We need to step up and do what we need to do as council people, because a lot of us get all the calls, but we need to be a part of this. So with that, I just want to make that motion to approve that the ordinance that Ms. Redall read, the first one, to start the lockdown on Sunday, 6 a.m. and end the following Sunday at 6 p.m. That'll be my motion.
I'll second her motion.
Okay, I stand by. So Councilwoman Little Hawk Weston, when Councilwoman Mills first spoke, I guess not for the record, acknowledge her motion, but she did make that motion to approve. However, she didn't implement a timeline. I don't know, Councilwoman Mills, are you in agreement with that timeline from Councilwoman Little Hawk Weston?
Yes, I am, but I really think we need to up that fine to at least 500.
Is that what part is part of the plan? Lockdown?
Yeah, no, that's in the lockdown ordinance. There's a fine associated with it.
I don't know how the rest of the council would see that. What was the fine now?
$250.
$250?
Agreeable at $250.
Yeah, because I just really see that
Chair, I'll just withdraw my motion and let Sonia go with her motion.
Yeah. Okay, that'll be my motion, Mr. Chair.
Okay, I got a motion and a second by Councilman Greenwald. I have a few hands up. Let me go to them first before I run the vote. District Chairman from Pine Ridge Village, Derek Janice.
Okay, I had my hand up for a while because I wanted to talk about the lockdown and how it was going to affect our district lockdown. But I feel I have to address what Miss Wilson said about Pine Ridge Village. I don't agree with everything she said. We help our people. We're out here in our community helping. If they want to help their people that live in our district, then fine, help them. But don't expect us to give them that help. It turns into territorial. Maybe instead of Pine Ridge becoming Walk-Bomany, why don't Walk-Bomany become Pine Ridge? I took real offense of that, and I'm getting text messages from my community. They're upset about her comments. And I don't want to go too far off, but the lockdown. I'll get back to the lockdown. We at Pine Ridge District, we're implementing a lockdown that's starting tomorrow at 10 p.m. How is your guys' lockdown, which is way different from Pine Ridge District's lockdown, going to affect our lockdown? We already gave notice. We issued letters to the stores. Everybody's ready to shut down. Our people prepared. We have a plan for the people that may have not prepared. Our lockdown starts tomorrow, and your guys' lockdown. I mean, I like that you guys are planning to lock down, but with all the passes that are going to be going around, it sounds like another shelter in place. So if you guys want to put another shelter in place in, why don't you just do that and then allow us districts to lock down, and we'll be the bad guy to tell these people, no, you can't move. We have a plan for our medical passes. We have medical staff that are going to review all the medical passes that came into our call center. We've been preparing for this all week. We gave people 4 days notice to prepare for our village. We're ready to do it. You guys let Wounded Knee lock themselves down. What's the difference from Pine Ridge locking ourselves down? We want to do it. Let us do it our way. And that's all I have. Thank you.
Thank you. Councilman Little White Man?
No, I forgot to take my hand down.
Okay. Councilwoman Whitehorse? Yeah, I'm going through the list. Councilwoman Whitehorse?
Thank you. I just wanted to make sure, Sonia, that you accepted the amendments, like for the dialysis patients and the 48-hour notice. And then I guess I have a question for that, since this is just the ordinance to approve the lockdown plan. Does it have to have dates on it, or can we do that when we approve the lockdown ordinance? I mean, lockdown resolution. I guess that one's a question for Jennifer. But the first one is for Sonia. Are you including the amendments that we suggested earlier?
Yes, I'll include the amendments that were made earlier.
Okay, thank you. And then Jennifer.
Yeah.
Jennifer, the second one was for you. Are you still there?
Yes, I'm here, and that's why I had my hand up. Just wanting clarification on the motion, because the motion to approve the ordinance is just to approve the ordinance. It doesn't. The ordinance itself, as I mentioned earlier, that doesn't declare it lockdown. So you need a separate resolution declaring the lockdown pursuant to the ordinance. I have one drafted and ready to go. That one will have the dates and times in it. So you will need this separate resolution that actually declares a lockdown. What you would be voting on the ordinance is just to create the framework.
Okay, thank you for that clarification.
Jennifer, this is Rayanne. I think we need to put the notice in the ordinance. I think that was the timepiece that was left open. So just the notice piece as to how soon we need to give notice to the public and businesses and stuff.
Rayanne, one of the amendments that I mentioned earlier was a 48-hour notice. A minimum of 48 hours.
Okay, and that was agreeable to everybody, right?
I guess that's what Sonia just said.
Okay.
And then she had mentioned drivers. Is that would you like included under additional permissions, or how would you like us to ensure that that's included? Because I think that can be addressed in the plan, but if it's something you'd like in the ordinance, we will need to know
that was also an amendment in the plan. Rayanne said she got all of them down.
Okay, so the only change to what Rayanne read would be to have the 48 hours, and everything else would be in the plan.
And make sure that the checkpoints are checking incoming and outgoing vehicles, and make sure that the dialysis patients also include driver passes. And that the elderly meals is changed from 10 days to 7 days or weekly. And funeral passes for pallbearers. And where the application will be available. And also that the mental health plan be sent to us, because it hasn't been.
Now, I believe all of those particulars are included in the lockdown plan. So those would be changes to the plan itself versus the ordinance, which just requires that there be a plan when a lockdown is declared.
Okay, but these were amendments to this ordinance that has all the plans in it. The one that Sonia motioned for, because that's what we were discussing all day, right?
I guess there's to clarify, there's the ordinance, which allows for the tribe to call for a lockdown. Within the ordinance, it requires that there be a plan whenever a lockdown is called.
And all of those plans were discussed today as a part of the ordinance. Yes, they were. That's what we talked about all day.
Those would be the resolution, the resolution approving the lockdown and adopting the lockdown plan for that lockdown.
Okay, so that's the motion that I'm going to make.
But if you want something different, we can certainly amend the ordinance. But the way the ordinance is drafted is it just calls for It sets the framework for how a lockdown is called, sets the criteria, and then says that a plan, whenever you call a lockdown, there needs to be a plan accompanying it. I have a separate resolution declaring the lockdown. Within that resolution, you adopt the plan, adopt the lockdown plan.
Okay, so that will be my motion. Yeah. That will be my motion, Mr. Chair. I'll restate my motion, Mr. Chair.
Okay, go ahead.
That I will make a motion to approve the resolution. Jennifer, how did you word that again?
The resolution wasn't even read.
Yeah, we're getting too confused. So it was a motion to approve in that ordinance has to be put in there, which
okay, the ordinance has to be approved first.
And stated will be put in there. Right.
Yeah, so I'm going to make a motion to go ahead and approve the ordinance. In the ordinance to include the lockdown plan. Is that what you're saying, Jennifer?
Well, it's not written that way. The ordinance basically says, and Rayanne read it, it says that the reservation-wide lockdown is authorized. And then it tells you how you declare it. And it says part of the declaration is that there has to be a lockdown plan that goes along with it. So now you have so if you adopt that, you have the ordinance that allows you to declare a lockdown. Now you have to do it by resolution. The resolution approves whatever plan for that lockdown, because you may decide in future lockdowns that your plan's going to be different. Things may change. You don't know. So that would be
so then I guess that'll be two motions then. So I'll make the motion to approve the ordinance for the lockdown plan. But before Mr. Chair, I think there's some questions being asked. If this is approved today by the tribal council, we also have districts that, like Pine Ridge Village, is saying theirs is going into effect tomorrow. I guess our attorneys need to probably weigh in here as to which ones do we, if we start this, if we decide that we're going to start this on Friday or Sunday, which one is holds more weight here? Is it the district one for Pine Ridge Village or the one from the tribal council? I'm assuming it's the council, but again, if you could clarify that for us, Attorney Jennifer.
I mean, the council action is going to supersede everything, because the authority of the district is, it can't be inconsistent with the council, and then the Constitution. It has to follow the council's ordinances.
Okay.
So it would be the council.
So they would basically have to go along with what the council passes today then. Right?
Hold on. Yes.
Okay.
Laws.
We just need to make sure we understand that, because we don't want the people to start calling us.
Just so everyone knows, Article 6 of the Constitution, the last line says, the actions of district councils shall not be inconsistent with the Constitution and bylaws and ordinances of the tribe.
Okay. All right. I guess, council, I think we heard that. And with that, I'm just going to make a motion to approve the ordinance adopting the lockdown plan.
Okay, I acknowledged your motion. Councilman Greenwald, is that still your second?
No.
Okay. Before I turn the floor over to you, Councilman Greenwald, I do want to say to the attorneys now, how does that read? I mean, why would the districts be inconsistent with the tribe if the tribe, if the districts already took action? They took action in the Crazy Horse Planning Commission. 7 out of 9 districts came up with a plan and took action, and it passed by those 7 districts in the commission already for their lockdowns.
But, Mr. Chair?
Yes.
The reason why I asked that was we're getting calls or text messages from our community of Red Cloud. And they're saying, well, we still got to come through Pine Ridge Village. So how's that going to affect us? You know, they might be emergency, essential. I mean, they're just questioning us on this, so that's why we need clarification. I think the council's also asking that question through the group chat here. So that's why I asked the attorney to clarify that.
I don't think that
our dates are different.
We don't really have, well, I know we haven't seen any of the district lockdown plans, so I can't really comment on them specifically. I can only tell you what the Constitution says and what the authority of the council and the authority of the district is. And I'm reading the Constitution to you, but as far as the specific plans, I can't comment on that because I don't know what they said.
So are we supposed to recognize both? You know, just go ahead and do the tribes, and then the Pine Ridge is still going to do their lockdown tomorrow?
Not just Pine Ridge, there's 7 other districts.
Comment?
Let me turn it over to Councilman Greenwald.
I think we just got to remember that it's 7 other districts too. It's not just Pine Ridge, and there's Pine Ridge already has a plan set up. If the tribe in its entirety was not going to do a complete lockdown, Pine Ridge was going to continue on with its lockdown, and they already have people hired to do checkpoints. So if you were from Oglala or any other district and you were having to travel through Pine Ridge because of a medical emergency, they would escort you through town up to the hospital, and then when you were done, they would escort you back out of the district on your way back out. So what they don't want is people coming in and milling around and going house to house, partying, doing stuff like that. So, but they do have a plan in place. The district does have a plan and does have staff ready.
So that's the reason why we're asking, so we could know what.
Councilman Greenwald, Councilman White.
Thank you. I'll second Sonia's motion and adding the 48-hour notice for the ordinance. But just to clarify, in this ordinance, the fine is up to $500. It's not $250. It's $500. And in the shelter-in-place ordinance, we authorize districts to implement their own lockdown plans where necessary. Remember that? But I'll second Sonia's motion.
Okay, so I got a motion and a second. Councilwoman Tapio?
And I'm going to say it again. What are we going to do about the homeless people? That's my question. If we're going to lock down, what are we going to do with these people on the street? The other question I have is Ruby Schluter right now is in charge of feeding them meals daily. Her question was, do I continue to feed them if there is, but I really think we need to come up with something. We're making all these grandiose plans for lockdown. Street and answer. The other question that I've been asked is, what about the post office? Is that going to be closed down? Were they notified that they're going to shut down? And if they did, are they in agreement? The other one is the early voting. Does that shut down? When you say shut down, everything is going to shut down. Is that the way it is? Hello? Hello?
We can hear you. We hear you, and not to mention the census.
Yeah, we can hear you. I think our attorneys need to give us some advice here. Who supersedes the lockdown for a district versus the council action? That's confusing everybody.
Yep, that's what we need to hear.
Okay. I know that Attorney Barrigal rendered her decision, and it's correct as to the law. However, You also have to understand what Councilmember Whiting said is correct. There was specific authority granted to the districts to carry out their own enforcement procedures. Now remember, each district has its own independent constitution, its own independent quote unquote district governing body. So they are able to take certain actions within the boundaries of their district in order to do what they need to do to affect what the tribe is calling a lockdown, but what they're calling, let's call it community enforcement. Okay. And so as Councilmember Greenwald said, if someone comes through the Pine Ridge District, which has already created such an enforcement provision, which would only enhance the council directive, the council ordinance, and to that extent, you're not superseding anybody. The districts are not trying to be above the council. They're just doing it sooner. And I think that if you look at it from that perspective, the districts are self-governing to the degree that they can determine things for their own district that Ms. Whiting said correctly was given to them with regard to quote unquote lockdown. It's a horrible word, okay? But they're trying to do district enforcement that the tribe has said they cannot do yet without regard to the overall ordinance, which would apply to all districts. I hope I didn't confuse it more, but that's how I see it. And I'm lowering my hand now.
Thank you. Let's see, Councilman Jumping Eagle.
Oh, Chair, I think I just forgot to lower my hand also. But I think we need to make a decision here, though, Chair. I mean, all we're doing is confusing people. You know what I mean? People want to. They need to get prepared if we're going to lock down soon. You know, we need to come up with a decision. We're just going back and forth, back and forth.
Mr. Chair, this is Robin. I think I got cut off and I didn't get to finish what I was saying. I asked about the homeless people and the feeding of them. But the last thing I wanted to say was that, this is turning into mass confusion. And the thing I wanted to say is that, we did pass, at one time we passed a motion on a resolution to give that authority back to the districts. And I felt we should have left it there. Instead of bringing it back to a reservation wide, let each district, we all and everything, and I just feel like Pine Ridge Village is getting stomped all over here now after they did, took the time and effort to put something together for our district. I just feel like we're being disrespected because of what the district did. So I just want to say that, we should have left well enough alone and left it back to each district to plan accordingly. Thank you.
Thank you, Councilwoman Tapio. Okay, I'll come to you next, Councilman Cross. Let me go to Councilwoman Killsmall Janice.
Thank you. I don't think we got a straight answer on the question that was imposed about the districts. But, it was announced, and I don't know if the plan was to lock down the whole community, just communities, or do the roadblocks, So I don't know if we didn't get that answer. We still didn't get an answer on the shelter. The homeless people. I know at one of the task force meetings, Cindy had suggested that if they didn't start the renovation on Billy Mills, it should be open during this lockdown for our homeless. And another issue is, I don't know, it's getting scary. And I don't want to be repeating, but, I think that we do need to make a decision, and I think the attorney needs to let us know which is which. Is it the tribal or the district?
Okay, so the the tribe has the ultimate authority. In your shelter in place, you did authorize districts to develop COVID-19 emergency plans. Their plans, however, can't be inconsistent with that ordinance, which is the shelter in place, or the tribal constitution. The constitution says that the district can take action, but that can't be inconsistent with the tribe's constitution, bylaws, and ordinances. So whatever action the districts take, it can't be inconsistent with what the tribe has adopted. So they do have some authority, but they can't. They don't have more authority than the tribe. You can certainly address it in this ordinance if you'd like to. If you want to be clear as to what and who has authority with regard to district level lockdowns. I will say, though, I have not seen the district plan, so I don't know. I heard earlier that they are different from what the tribe's plan is, so it's possible that the plans that the district came up with are well within the scope of the shelter in place and other and their authority. I just don't know what they look like. And I think that that Lisa did a great job explaining what happens between the local level. You're talking about the local level of governments versus the tribe as a whole.
Thank you, Madam Attorney Barrigo. Councilman Cross.
Thank you. Thank you, Chair. And, I guess we should be getting ready to vote, but the way I see things is that the people have the ultimate authority, and then they comprise of their districts or their communities or TOSPAs in their community, and then their districts, and then I always say this: the tribal council is below the districts, but I know we make the ordinance and the laws, but and just for the record, I support the districts their plans, their COVID plans, and I had an opportunity to work with the district task force over the summer, and also working with the tribe's task force. But there's a breakdown of communication between the task force and the district task forces, that there's not enough information given to the district task force to help families with quarantine when some. And the community and the districts know their community better than the tribe's COVID task force, and we have that ability to lock our people down, to lock our families that are on quarantine, to help them and to monitor them, but we're not getting those names because it is HIPAA law. And if we had that information as soon as those families get tested positive, we can address this matter immediately. But we're not getting nothing because it's a water's HIPAA law, and we don't want to do that. But and I told the task force this is that when somebody tests positive, we know before they even do. And so that's how the district task force are really efficient. If we allow them to proceed with it and to let the district do their own lockdowns and implement all the resources that are available, because we do have the money, just that we're not allowing our districts to do that. So I think it's really important to look at that, but we're in a bad situation here, especially with we're not starting a reservation boundaries, with all this, there's no mandates in place, and then our people are going out there, so we're in a bad situation. But just for the record, I support the district block. We're going back to the first lockdown ordinances, and we're like, everybody's going to want to pass sooner or later, maybe by Wednesday or Thursday. Everybody's going to want to pass, and so. But it does create a psychological effect on our people. But I just, people have to realize that. And Mr. Gibbons, he did state it for the record that every human being on the reservation has to do their part. Everybody. That's the only way we're going to beat it. We all have to just, comply with CDC guidelines, and and sometimes our people don't have those hand sanitizers at home, or those face masks, or and the education has to be there. So my question to the task force is to kind of look at yourself. What are your strengths and your weaknesses as a task force? Thank you, Chair.
Thank you, Councilman Cross. Councilwoman Mills.
Yes, thank you, Chair. I thank the districts, those that did come up and are moving forward with the protection and safety of their people within their district. However, us in our roles as tribal council, and we have to look out for the health and welfare of all our people. That's what brings us back to why we're discussing this today. Again, they said not all districts were on board with this plan that they were moving forward through their districts, and that's where I struggle with too. I respect that our district did that, but if we're trying to make decisions, and this is a pandemic, and that's where I get into this, and we're making a law that has to be enforced through tribal courts and law enforcement and the districts. So just to give you an example, tomorrow, and then they want to fine people, it's not going to go anywhere because it has to come down through this system that we have in place. If we want to change that, again, constitutional reform. So again, that's why we just need to do this as a legislative body. And I appreciate, all these things that have come forward. I apologize to the Oyate. Hopefully we will get it together so we're not sitting here and discussing why we have to do this and empowering our districts. I believe that 110%, but constitutional reform. Thank you.
Thank you, Councilwoman Mills. Councilwoman Little Hawk Weston.
After looking at making the motion earlier, I don't know if I could agree with the $500 fine. I know Ms. Whitehorse did put that as part of the amendment. Are people out there listening? And right now the fine is $250 if you are caught not abiding by the actions of the council. And this time you get caught, if this passes with a $500 fine, that you will have to pay that $500 fine. That needs to be told to the people, the Oyate out there, that that's what's being inserted into this ordinance. And today, I just can't see us raising $500 fine for people when they're having a hard time as it is, and when they're expecting help from the people, from the tribe, and yet we want to up the fine to $500. I just couldn't see that right now. And so I'm going to withdraw my motion on that ordinance. If somebody wants to go ahead and motion to approve it with the amendments.
Mr. Chair. I wanted to clarify that was not an amendment I made. That was as the ordinance was read. In the last, therefore be it ordained, it says $500. It doesn't say $250. But if you're going to withdraw your motion,
I'm just withdrawing.
I'll make the motion to approve it.
Second.
Okay, got a motion and a second. Superintendent Long?
I second that.
One of the issues that was just raised to me, and maybe Dr. Jumping Eagle or somebody can address it, is, for instance, Pine Ridge's medical procedures as far as appointments. If they send an email to this email address, I mean, are we pushing the boundaries of HIPAA on even that, releasing why they're having to go to Rapid City or wherever they're going? I mean, that's one of the concerns that was just raised to me.
if somebody can answer that.
I'll respond. So they can request a medical pass with verification that they actually have an appointment. If they're the ones that are initiating that, then there's no HIPAA violation. So so I hope that answers your question.
Yeah, I think their concern is just, why do I have to tell them why I'm going to a doctor's appointment? Why won't me telling the district that I have an appointment suffice?
So what we're trying to do is cut down on the people who are needing to go for, say, I want to go get new glasses, or I have a dental appointment. These are the types of appointments that we're asking them to reschedule. So if they're chronic issues or emergency issues, they will get a pass.
So one question that was just texted to me, for individuals that don't have the ability to do dialysis here on the reservation, do they need a pass to go do their treatments in Rapid City?
Yes, they just need to do the application for the dates that they have their dialysis scheduled. Anybody who wants to leave the reservation will need a pass if they're coming back. And they will need a pass to enter the reservation.
Okay, thank you.
Next on the list is Ryan. Jumping Eagle.
Chair. Can you guys hear me?
Mm-hmm.
So I think the idea of a higher fine is, no one, and I know we have people, or a lot of us can't afford a high fine, but if we have higher fines, you think the idea is to keep people home. That's our whole point for a lockdown, is to keep people home, so they're not out spreading. I mean, I don't see. We're just going back and forth again. Let's vote and let's move forward and let people know.
Oh, thank you, Councilman Jumping Eagle.
Yeah, feels nice in here.
I have Madam Attorney Barry Eagle. Do I have any more hands up?
I just wanted to. Okay, sorry, I keep getting texts which are disrupting my speaker, but just wanted clarification, because in the draft it says $250 for individuals and $500 for businesses. So I just wanted to clarify what the actual fine is, because I heard because Councilwoman Whitehorse said that the draft says $500, but the draft only says $250 for individuals and $500 for businesses. So I want to make sure we're all on the same page as to what the ordinance actually says.
Okay, thank you for clarifying that, Jennifer. That's what I thought.
Okay, thank you for that clarification, Jennifer. Councilwoman Whitehorse, is that still your motion?
Yes, can we run the vote?
Yes. Councilwoman Bear Killer, still your second?
Yes.
Okay, Madam Secretary,
Comment.
call for the vote, please.
Real quick comment, President, question.
Yes, go ahead, Councilwoman Little Hawk Weston.
Okay, thank you. So this is with a fine at $250, right?
Yes, as the ordinance was read.
Okay, thank you, Cora.
Madam Secretary, call for the vote, please.
Jim Meeks, Jim Meeks, Dwayne Yellowhawk, Dwayne Yellowhawk,
Yeah.
Garfield Apple,
No.
Glenn Gibbons,
Yes.
Lydia Bearkiller,
Yes.
James Cross,
No.
Sonia Little Hawk Weston, Jackie Sears,
Oh,
Vincent Tulance,
Yes.
Craig Dillon, Craig Dillon, Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentina Merdanian,
Uh-huh.
Ryan Jumping Eagle,
Yes.
Bo Little White Man,
Yes.
Chancey Wilson,
No.
Philip Goodcrow,
Yes.
Randy Laisbad,
No.
Richard Greenwald,
No.
Nakina Mills, Robin Tapio,
Yes.
$14 yes, 5 no, 0 abstain, 2 not voting.
Chair.
Motion carried. Motion carried. Whose hands up next, Madam Secretary?
Nakina and then Chancey.
Chauncey was before me, so I'll let him go first.
Okay, Councilman Wilson.
Okay, thank you, Mr. Chair. Since we're going to move forward with the lockdown, and there's a lot of people that do not work for the tribe and are on admin, don't have the administrative leave. They work for private businesses. 2 motions here to help those that are affected, that have jobs that aren't related to the tribe or a government agency that either work here on the reservation or must have to drive to and from off work. My first motion will be to reimburse individuals that work for private businesses that were forced to be locked down during the shutdown, with a reimbursement up to $1,000. They must bring in a pay stub and a letter from their employer to being reimbursed up to $1,000 out of CARES Act money. That's my first motion.
Haven't even passed the lockdown yet.
I think those were just the guidelines.
Okay, Councilman Wilson, I will acknowledge your motion. Madam Secretary, who's second by Councilman Cross? Madam Secretary, do I have any hands up?
I do. I have a question. I have a question.
Yes, you
Mr.
do.
Chair.
We have
I have a
Nakina
question.
next, then Valentina, then Jennifer, then Cora, then Sonia.
Hold on. Okay, Councilwoman Mills.
Yes, thank you. Okay. I would like to hear from Mason, the treasurer, in regards to Chauncey's motion, because I think if I totally would support something like that. However, I think we need to go through the process of how we'll have to do like an amendment to our COVID budget and such for this type of thing, which could be done in finance committee. But yeah, so that was what I was going to say about that. I have another motion after whatever we decide to do with, well, I guess I'm going to table Chauncey's motion and send it back to finance. Because I just don't think that's something we can get worked out today, but I do want to hear from Mason on that too.
I'll second her motion.
Okay, so I got a motion to table and a second. Madam Secretary, call for the vote, please.
I had a comment.
Okay, let me run this tabling motion first. Madam Secretary, call for the vote, please.
Jim Meeks. Jim Meeks. Dwayne Yellowhawk.
No.
Dwayne Yellowhawk. Can hear.
No.
Thank you. Garfield Apple.
No.
Glenn Gibbons.
No.
Lydia Bearkiller.
Yes.
James Cross.
No.
Sonia Littlehawk Weston.
Ha.
Jackie Sears.
Oh,
Vincent Tulance.
Yes.
Craig Dillon. Craig Dillon. Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentina Merdanian.
Yeah.
Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Chancey Wilson.
No.
Philip Goodcrow.
Yes.
Randy Laysbad.
No.
Richard Greenwald.
Not voting.
Nakina Mills. Robin Tapio.
Yes.
$11 yes, 7 no, 0 abstain, 3 not voting.
Okay, Mr. Chair, on my second motion, it's
Motion
going to
to
be
table
simple.
passed.
Wait, was that carried? What was the motion carried, Mr. Chair?
The motion carried was to table his motion reimbursing people that work for private companies, bringing in check stubs for verification and letters from their employer.
Okay, so it passed, right?
No, yeah, the motion to table passed, yes.
Okay,
Yes.
thank you.
And
Okay, Mr. Chair, I had two motions on the floor. I guess I'm going to change my second one just a little bit because it'll be tabled again. But my second motion will be to reimburse private businesses affected by the lockdown and shutdown that are forced to shut down during the lockdown. Reimbursement up to $10,000 to move to finance to bring back to a plan for both the individual reimbursement and the business reimbursement to tribal council next week.
Second.
Okay, I got a motion and a second. Do I have any questions or comments on this motion?
I have my hand up.
Okay, go ahead, Councilwoman Merdania.
I just want to clarify for council as well as the listening audience, the ordinance that we just passed is an ordinance that defines when a lockdown is called and then who calls a lockdown. It's based upon 3 criteria. First one is over 200 cases, a recommendation from the COVID-19 task force, or if it comes from a standing committee. Those are the 3 criteria in which a lockdown can come forward according to this ordinance. Within the ordinance, it says who can pass a lockdown, and that is tribal council or the executive board. Third part of this ordinance is recommendations. It's not saying you cannot go to your medical appointments. It's recommending you try to change your medical appointments if you can during a lockdown. It doesn't say you have to. It doesn't say that you have to stay within our boundaries if you work off the reservation. It's suggested if it can't happen, then it can't happen, and those people can get a pass to go to their work off the reservation. So, Chauncey, my understanding of your motion for those people is within the reservation boundaries that cannot go to work because of the lockdown, and the businesses that cannot operate and lose income because of the lockdown are within our boundaries, correct?
Correct.
Okay, so with that would fall, it should fall within those plans that were brought forward. And again, those are just recommendations in regards to the ordinance. If you read through them, it says suggest or recommend, but it doesn't say that they have to, they shall. So I think that's the clarification in which committee and council needs. And I understand where you're coming from in regards to individuals who work outside the tribe, who aren't getting admin leave, and for those businesses that don't fall under tribal enterprises. So just wanted that clarification because a lot of people are confused out there. And so I want to get that out there. And I think it's important that we do look at our people who are not able to get the administrative leave that do not work for our tribal programs. Thank you.
Thank you, Councilwoman Merdania. Councilman Whitehorse.
Thank you. I think that Chancey has a good motion and we will go over it on on tomorrow at finance. I think that we need to include like the grocery stores, essential businesses, those are all included. So they'll be able to work. But like the restaurants, the I don't know what else. The nonprofits that we have that can't get admin leave, those should be included as well. And other small businesses. But we will discuss that on Thursday for the businesses and nonprofit programs. Whether it's passed or not.
Thank you. Okay, thank you, Councilman Whitehorse. Madam Attorney Berrygo.
Yes, thank you. Just to follow up on what Councilwoman Whitehorse mentioned, we do have a draft ordinance, which is that small business grant program, and I believe this sort of thing can fall within that purview. And so hopefully we'll be able to bring that back and discuss it tomorrow at Finance. Just FYI that this is something that the Finance Committee had been working on, which is that small business grant assistance fund. Thanks.
Okay, so I got a motion and a second, and then it's going to be sent to tomorrow's Finance meeting. Madam Secretary, call for the vote.
Jim Meeks. Jim Meeks. Dwayne Yellowhawk. Dwayne Yellowhawk. Garfield Apple.
Yes.
Glenn Gibbons.
Yes.
Lydia Bearkiller.
No.
James Cross.
Yes.
Sonia Littlehawk Weston.
Yeah.
Jackie Sears.
Yeah. Sorry.
Vincent Tulance.
No.
Craig Dillon. Craig Dillon. Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentina Merdanian.
Uh-huh.
Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Nancy Wilson.
Yes.
Philip Goodcrow.
Yes.
Randy Laisbad. Randy Laisbad. Richard Greenwald.
Yeah.
Nakina Mills.
I apologize. Can the motion maker repeat his motion?
I do think, look, this is a closing argument.
Nancy Wilson.
Do what?
The secretary can read it. Restate your motion.
My motion was that the private businesses affected by a lockdown be eligible for reimbursement up to $10,000 during a lockdown, and the individuals that work for an private business and forced not to work during a lockdown be reimbursed up to $1,000, and it all be worked out and brought back tomorrow at Finance and brought back next week to Council.
Huh.
Robin Tapio.
Yes.
$13 yes, 4 no, 0 abstain, 4 not voting.
13 yes, 4 no, 4 not voting, 0 abstain. Motion carried.
Mr. Chair. Mr.
This
Chair,
is
I have
Jackie.
a question. Me too, Robin.
Okay, if you guys could raise your hands, I'll record you now. But if you can raise anybody else, raise your hand so we can go in order as they're received. Councilwoman Sears and Councilwoman Tapio.
Yes, just thinking about the food part, for the districts, I believe that, the districts did agree on the distribution of funds to the districts to help. I'd like to make that motion to go with that plan and send it to finance also on Thursday and bring back to council on Tuesday. So that's my motion.
Second.
What happened?
Okay,
It'll
so
help
that's a motion by.
alleviate- Yeah.
Okay, so just clarify your motion one more time.
Yeah, the districts from the Crazy Horse Planning took action to distribute some monies to the districts to help during this lockdown. So I think, that's my motion, is to send it on to finance tomorrow and then to the regular council meeting on Tuesday.
Okay, just clarification, the action was not taken in
Just
Crazy
say
Horse.
supplemental.
However, it was presented, but no, hold on, let me finish.
Yeah.
It was presented to the commission, but we ended up losing the quorum. So I'll just let Chairwoman Tobacco know to bring her plan to finance tomorrow. But I'll still run your motion for it to go to finance.
Yes, please.
Okay, do I have a second?
Second.
Second by Councilwoman Mills. Once again, for everybody that's going to be voting, this is a motion. There was a plan presented by the chairwoman of
Wakpamni District.
Yes, Wakpamni District. And so that plan will be, this is a vote to send that to finance tomorrow, then to be brought back to tribal council.
Yes.
Okay, so Madam Secretary, call for the vote, please.
Meeks. Dwayne Yellowhawk.
Yes.
Garfield Apple.
Yes.
Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross.
Yes.
Jackie Sears.
Uh-huh.
Sonia Littlehawk Weston. Vincent Tulance.
Yes.
Craig Dillon. Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentino Merdanian.
Uh-huh.
Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Chancey Wilson.
Yes.
Philip Goodcrow.
Yes.
Randy Laisbad.
Yes.
Richard Greenwald.
Yes.
Nakina Mills. Robin Tapio.
Yes.
19 yes, 0 no, 0 abstain, and 2 not voting.
Thank you, council.
Yes. Councilman Wilson, did you have anything further? Oh, go ahead, Stacy.
You have Robin Tapio and Jackie Sears and Attorney Barry go on your list.
Okay.
I didn't have time to text it to you.
Okay. Councilman Wilson, you're done?
You don't have to, I took my hand down.
Okay. Councilwoman Tapio.
Okay, thank you, Mr. Chair. Okay, I have two questions. The first one is, I got a text and did, the mobile bank is wondering if they're allowed on the reservation during the lockdown. That's the first question. Did you hear me?
Yes, we did.
Okay.
I guess I'll ask Rayanne from the task force if she'll respond to that question.
I'm sorry, can you repeat the question, please?
Will the mobile bank from Security First in Rushville, Nebraska be allowed to travel to the reservation during the lockdown?
We had it on there initially, but then wouldn't that encourage people to move about?
I don't know. That was your guys' decision. They just asked me to ask if they're allowed on the reservation. A simple yes or no.
I don't believe they're on the past plan.
Okay, so no, they're not allowed. So we need to let people know that they won't be getting any banking services. Okay, can I ask the next question now? Hello?
You still have the floor.
Oh, okay. Sorry. I didn't know it. Did I thought I was disconnected there. Okay. And the next question is for the attorneys. Can you hear me?
Yes, ma'am.
Okay. It's in regards to the early voting during the lockdown. Is it going to be allowed? Because, and this is what I want the attorneys to answer. Early voting, it's part of the federal law, the Help America Vote Act. So, would we be in violation of anything if we are asking them to close down?
Are you speaking of the national election?
Yes.
Well, the federal law would supersede in that instance. The issue becomes, how do you set up the polling places to accept the early voters? And my suggestion is to have the polling places set up, do the X's on the floor, 6 feet apart, and have a box for the ballot to go into where there's no contact with the machine, just with the paper into the envelope and into the ballot box. That's
Lisa, she's talking about national.
Yeah, exactly.
At the
voting
sites.
Yeah, that and you're talking about the ones that are stateside, but you've got them on the reservation too, don't you?
Yes.
Yeah. Okay, so it's the same process as excuse me, as they did here in Rapid. They had it set up where the voter goes, they present their ID and or their voter registration form. The teller fills out a ballot showing, whatever information goes on that. They hand it back to you, excuse me, and then you go to a table where there are, little voting shields up for privacy, but also theoretically to prevent spread. They were all 6 feet apart. There were little X's on the floor. And then they just had a red metal box where they just slid the envelope in for the state and federal elections. That's how they did it up here, because I voted early.
Robin, we can't we can't shut it down. That's federal.
Okay, that's good. Yeah. Okay, last thing. Is Pine Ridge Village's lockdown going to be recognized?
as long as you don't call it a lockdown, and again, I'll explain this again. The district can take whatever action it needs to take for the district's own safety measures, provided that whatever you do does not exceed the limits of the lockdown ordinance. Okay? So if the district council took action to have community patrols, to slow down partying, to do whatever you need to do to keep people out of the circumstances that cause these super spreader events, then yes, you have that autonomous authority as a district because it does not violate the tribal ordinance that says, you know, you can go here, you can't go there. I will make an assumption and hopefully not make an A out of you and me, but to say that if you have businesses in the Pine Ridge District that fall under the ordinance as being non-viable, in other words, they cannot be open, the district can independently say, oh, well, you'll stay open, that violates the ordinance. Okay, so long as what the district does in its own autonomous authority, as look at it as like a Rapid City or a Hermosa, as long as what they do doesn't violate overall tribal ordinances, aka tribal law, you'll be fine. Okay, but like you can't go have your people that you have kind of doing these citizen patrols arrest anybody, and so you just have to follow the limits established in the ordinance. But you can have your own system because that's specifically laid out in the shelter-in-place ordinance, and it's the district councils that have that authority under the Constitution to do what they do without violate, so long as they don't violate the Constitution or the tribal body of law.
Okay, thank you.
You're welcome.
Madam Attorney Barrigal?
Yes, thank you. I wanted to see if there was going to be a motion to approve a lockdown, because I have a resolution.
Can you read the resolution?
Go ahead and just read your resolution.
Okay, resolution of the Tribal Council of the Oglala Sioux Tribe approving and authorizing a reservation-wide lockdown for a 7-day period beginning October 25th, 2020 at 6 o'clock a.m. to November 1st, 2020 at 6 o'clock a.m. Whereas the Oglala Sioux Tribe adopted its constitution and bylaws by referendum vote on December 14th, 1935, in accordance with Section 16 of the Indian Reorganization Act of 1934, 25 U.S.C. Section 5123. And under Article 3 of the Constitution, the Oglala Sioux Tribal Council is the governing body of the Oglala Sioux Tribe. And whereas pursuant to the Constitution and bylaws of the Oglala Sioux Tribe, the Oglala Sioux Tribal Council exercises legislative powers to enact and promulgate resolutions and ordinances. And whereas Article 4, Sections 1F, 1K, 1M, and 1W empower the Tribal Council to manage the economic affairs of the tribe, protect and preserve the property of the tribe, adopt laws governing the conduct of persons on the Pine Ridge Indian Reservation, and adopt laws protecting and promoting the health and general welfare of the Oglala Sioux Tribe and its membership, respectively. And whereas the Tribal Council adopted Resolution number 20-70, affirming President Bear Runner's declaration of a state of emergency on the Pine Ridge Indian Reservation due to the novel coronavirus and named SARS-CoV-2 and the disease it causes, coronavirus disease 2019 or COVID-19, which is now a global pandemic. And whereas in response to the pandemic and risk posed to the health and general welfare of residents of the Pine Ridge Indian Reservation, as well as those who live nearby and work on the reservation, President Bear Runner and the Tribal Council acted quickly to respond to the global pandemic through the activation of a COVID-19 task force, limitation on off-reservation employee travel and in-person meetings, closure of in-person schools, and other public health measures. And whereas the Tribal Council adopted Ordinance 20-17, amending the OST Emergency Operation Plan by adding the Public Health Emergency Response Infectious Disease Plan that includes a 3-phase plan, adopted Ordinance number 20-18, Shelter in Place, in order to help decrease the spread of infection within the boundaries of the reservation, as amended, and readopted by Ordinance number 20-34 with further amendments. Adopted Ordinance number 20-32, COVID-19 Public Health Checkpoint Ordinance, and adopted Ordinance number 20-blank, curfew. And whereas on October 21st, 2020, the Tribal Council enacted Ordinance number 20-blank, Oglala Sioux Tribe COVID-19 Reservation-Wide Lockdown Ordinance. And whereas Section 1 of the OST Lockdown Ordinance authorizes the declaration of a reservation-wide lockdown when any of the following occurs. Quote, A, when there are 200 or more active COVID-19 cases on the reservation, or the on-reservation healthcare capabilities are deemed to be unable to handle the number of active COVID-19 cases. B, the OST task force recommends a reservation-wide lockdown. Or C, any standing committee determines that a public health emergency exists justifying the need for a lockdown, end quote. And whereas there are over 200 active COVID-19 cases on the reservation, and the OST task force has recommended the Tribal Council order a reservation-wide lockdown and has prepared a lockdown plan. And whereas the Tribal Council has determined that it is in the best interest of the Oglala Sioux Tribe and its members to order a reservation-wide lockdown for 7 days pursuant to Ordinance number 20-blank in accordance with the lockdown plan prepared by the OST COVID-19 Task Force. Now therefore be it resolved, the Tribal Council of the Oglala Sioux Tribe hereby approves and authorizes a reservation-wide lockdown for 7 days beginning on October 25th, 2020 at 6:00 a.m. and ending on November 1st, 2020 at 6:00 a.m. pursuant to the attached lockdown plan certification.
Motion.
Chairman.
Okay, got a motion by Councilman Bearkiller and a second by Councilman Apple. Councilman Whitehorse?
I think that we need to change those to Friday, October 23rd at 10 p.m., which is curfew, to Friday, October 30th at 6 a.m. when curfew is lifted for the day. My opinion, but I think that we should start it as soon as possible rather than waiting longer.
I agree with that. Numbers are rising every single day.
So I guess I'm requesting the motion.
Everyone talking.
Yes. Everybody, like I said, raise your hands on the Zoom so we can go in that order. Councilwoman Whitehorse, I gave you the floor. Please continue.
Okay, so I guess I'm requesting the motion maker to change the date if possible, or if not, then we just run the vote or whatever. But I think that we need to start it sooner rather than later. And Friday at curfew, I think is gives people plenty of time, and it does meet the 48-hour notice. October 23rd at 10 p.m. to October 30th at 6 a.m.
Okay,
I'll agree. Okay. I'll agree to change those dates from Friday night to October 30th.
Councilman Apple, still your second?
Yes.
Okay, Madam Secretary, how many hands do I have up, or who's next?
I have a question.
Nakina and Tina, but I think they lowered their hands.
Okay, Councilwoman Little Hawk Weston.
Just, I guess for clarification, I think that this, during the lockdown, the construction part of it is still included in the lockdown plan, right? They will be able to obtain passes, Rayanne, to get to and from?
Yes.
Okay, I'm just saying that because we got the school construction going on at Wolf Creek.
Yes.
And they're wondering, okay. Thank you.
As well. Agency
Oh, yeah,
building.
that one too. Yeah.
Madam Secretary, who was after Councilwoman Little Hawk Weston?
Tina?
Councilwoman Merdanian?
Yes, and just clarification in regards to this resolution, Madam Attorney, this question is for you. Is in the resolution, are we approving those recommended the plan that is being brought forward by the task force? Or are we just saying we're going with the lockdown with the dates that are being thrown out there?
It's the resolution says that you're approving the lockdown pursuant to the attached plan. The attached plan is what was presented by the task force.
Okay, so I have a concern regarding that because there needs to be amendments to those plans in all of them. For example, the food distribution, there was action taken earlier to have
They're not done.
Chairwoman. Somebody needs to mute
Wait,
their mic.
yes, stand by real quick. Madam Secretary, your mic is still hot. Okay, carry on, Councilwoman Merdanian.
So, Madam Attorney, I know there was action taken by council to have Chairwoman Mary Tobacco's recommendation regarding the food to go to Finance Committee and then to council. So, I believe Councilwoman Whitehorse had other revisions that she had mentioned regarding the various subcomponents within the plan. For example, to add to the list was the drivers for dialysis, and then with the food plan that is in place there, we never agreed upon that either, as far as budget and so forth. So if we pass this resolution without making those decisions, is that premature? So that's why I want to make sure that people understand that by go ahead and passing this resolution, we're approving the plans that were submitted within the overall plan, from the food to the passes to whatever else was it. Oh, the mental health piece of it. The plan, to develop a plan.
What I would suggest before you pass the resolution then is to pass a motion approving the plan with the changes, and then that would be what's attached to the resolution. So maybe take that action right now first and say, okay, here's what the plan is. By motion we're approving it as a council. This is the plan, and then that would be what's attached, and then enact the resolution to approve the lockdown with that plan attached.
Okay, council. This is where, your revisions, the amendments within the plan and the subcomponents within the plan need to come in.
I have a question for Jennifer Bear Eagle. I had my hand up. Is it okay to ask my question?
Yes, go ahead, Councilwoman Whitehorse.
I'm really getting frustrated with this because you know what? We talked earlier, we made our amendments. Rayanne said she wrote them down. When I asked if it had to be approved by the ordinance, you said no. You said it would be approved by the resolution with the amendments. And now you're saying, no, we have to approve it separately?
No, you don't. You don't. It can certainly be approved by the document you guys already discussed and approved today. It's just, if you want to, it sounded like there was not consistency. It sounded like there was not an agreement as to what that was.
Okay, Rayanne has all the amendments that were to the plan. She said she took notes on everything.
Suggest that would be what's attached to the resolution.
Yes.
Madam Attorney Barrigo, we wait until the councilwoman is finished before engaging, please, so we're not stepping on each other. Councilwoman Whitehorse, you have the floor.
So Rayanne took notes of all the amendments that needed to be put in, and she said that they would all work. And then I reiterated my amendments, and you said that they had to be approved by the resolution. So we have this resolution now to approve the plan and to approve the lockdown, but now you're saying we need to approve another resolution to approve the plan with the amendments? Isn't that what this resolution is for? This doesn't have to be this hard. We've been talking all day. We've been communicating what we need, what we want, and every time we turn around, you're adding more and more. So we have this resolution to approve our lockdown plan. So do we just need to add in with amendments into the resolution and change the dates? Or do we have to do another resolution?
Now you may respond, Attorney Barrigo.
No, you don't need another resolution to do that. It's just that earlier it sounded as if there was not an agreement amongst the council as to what the plan entailed. And I think it's fine that this approves it. No, you don't need another resolution to approve the amendments to that plan, as long as you are in agreement that what you are adopting as part of the lockdown resolution, that's fine. You just want everyone to be on the same page as to what is being adopted. And it sounds like if Rayanne has those amendments and everyone is in agreement that is what you are adopting as part of the resolution, then that's fine. There's no additional steps to be taken. What happened was it sounded as if maybe there wasn't any agreement and we weren't all on the same page as to what was being included and what the plan was. I didn't want it to seem as though, okay, you were adopting the plan that was initially presented and that's the plan, if you weren't all in agreement as to what it was. I think it's fine. No, you don't need another resolution to amend that plan. You just need to decide that this plan that you are adopting right now, everyone knows what's in it. There's no other changes, that this is what you are adopting. So I think that's fine.
Okay, and the only portion that was sent back to the committee that they were trying to put into the plan was the food vouchers, the food assistance. That was the only thing that was sent back to Finance Committee. So that's the only thing that's not in there now, but will be on the agenda for next week because we'll go over it tomorrow. Right?
President Chair, this is Rayanne. So I did take note of the changes needed for the travel passes regarding the driver for dialysis and adding in and out checks for border monitoring, and then changing the elderly meals delivery from I think it's from what was in the from the 10 days to the 1 week / 5 days, and then adding pallbearers to the travel pass plan. The part that I don't have clarification on as well is the food plan, the food budget, because so what was presented, there's 3 possible plans there, and I'm not quite sure how, if and maybe Cindy can answer this, but are we going to choose just one of, like, the low cost plan, the medium cost plan, or the, I don't know what that is. So I think we need to clarify the budget part of it in terms of the food plan.
And what about the homeless?
So I don't have an answer for you on that one, Robin. I don't know if anyone does. So I would just throw that out there that, if people have ideas on how that can be addressed, task force is open to it. And, we need help too in trying to figure out how to problem solve some of these issues. We don't have the answers for everything. So if you guys
Rayanne, I'll be having some people contact you. Thank you.
Thank you. So, Rayanne, were those budgets or the food plan, was that not included beginning, or is there 3 separate ones that were read at the beginning of this meeting?
It was presented, and so there's a food plan with a budget, but that budget also has like low cost, medium cost, and high cost for the amounts. So I guess that needs to be clarified.
If it was already passed with council action, then I guess that's at the discretion of the task force. I mean, we're going back and we're backstepping to correct everything that we just did. Okay. So that was already included. So we'll just, that's going to be on the task force to make that determination.
Okay, thank you.
And then for this, what Councilwoman Merdanian was talking about, that if that finance requires council to take action, or if it's under the threshold, you could just forward it to XB. If it needs to be implemented before to lock that into the lockdown resolution, I should say. Councilwoman Merdanian.
I agree. I do. I really agree. I think that needs to be moved forward ASAP.
Okay, so when you guys have that discussion and you hash that out with that plan in tomorrow's finance, then just send it to the XB and let me know right away so I can call for an emergency XB meeting and we could just take the action to implement it into the action today if there's action that comes for this lockdown.
Okay, one more question. Will NPPD be allowed to do hookups on the reservation during the lockdown?
I believe that's in the travel passes list.
Okay, thanks.
Sorry, guys, I stepped out of the room for a minute. Was there a question for me?
No, we got it hashed out. Thank you.
Okay. All right. Sorry.
So back on track, I guess, and just to give some affirmation, Councilwoman Tapio, I guess I can address that this evening in reference to the homeless. I'll get with Treasurer Bickrow to see if we've begun construction or if it's safe to do so to open Billy Mills Hall back up for them. And then I can get with Ruby or with the process that we already had set in place for the homeless prior to them closing Billy Mills Hall. If not, well, I'll find a secondary site for them.
Right. Okay. And then I'll have them contact your office too with their recommendation.
Okay.
All right. Thank you.
All right. Thank you. And then, so now back. Oh, Councilman Jumping Eagle.
Yeah, real quick. So, I'm going to say this again. We don't only have homeless in Pine Ridge. We have there's a guy, I got a text the other day of a guy sleeping in back of someone's house with on a sleeping bag. I mean, we need to have resources available from the tribe that looks out for all our homeless in each district. When we bring it up out here in the district, you say, well, that's why the district got money. But again, in Pine Ridge, they're taken care of by the tribe with the tribe's money, not the district. So we need to look out for the homeless in every district.
And I want to remind you, they're not all Pine Ridge.
Right. Okay. So just let's put a squash to this real quick. I'll try to find the site in Kyle. If we can't do that and we have to only use the site in Pine Ridge, then we'll work out some sort of safe transportation method for those that are identified in the districts to be brought to Pine Ridge during the lockdown, and then they can either, be taken home, or if we find a place for them to go after the lockdown. But during the lockdown, and then in committee maybe or something, we can make a long-term plan for our homeless people. But for this lockdown, we'll just an emergency measure. We'll try to find one site, if not two, one on east and one on west. And if not, like I said, we'll work this out in executive.
I got a question, Chair.
Is that okay? Oh, stand by, Councilman Cross. Councilman Jumping Eagle, is that okay with you?
Yes, as long as we're taking care of everyone in the districts, all the homeless.
Okay. Thank you, Councilman Jumping Eagle. Councilman Cross.
I know. I just got a message from one of our district members about our students going to school in Bennett County. Has the task force addressed that, or has the education committee addressed that? Because the bus does come all the way to Yellow Bear, and they drop students off at the housing. And is that can somebody answer that if that's if that's allowable? Because I know they still have to go to school. So.
James, in Education Committee, we did address this, and this has been part of the discussion and the planning. Each school has their plans in regards to distance, being able to provide meals for the students during this lockdown. And then those schools that transport our students off the reservation, they've been notified. And so they have to develop plans for those students because they're not being allowed to come onto the or come within our boundaries to transport. So those arrangements are being made by those schools. Codoka, Bennett County, Oryx, etc. So this has already been discussed within the Education Committee, and those schools should be contacting the parents of those students. Does that help you, James?
So the with this lockdown, they have to send their children to school because they're like I stated in a task force meeting, their attendance policies are different from the tribes, and there's even though there's a big outbreak in the school, they still have to go to school. So the children are still being bused to and from school. So is this lockdown going to affect the attendance of those children? That's my question.
The schools are working with those families that they transport to those school systems. So they shouldn't be affecting their attendance because they're supposed to be working out some type of distance learning with those students. Because according to the lockdown, it doesn't allow for them to come onto the reservation. And I know that their system is different than within our school systems here. So with that this has been part of that discussion. And the tribal ed director has also been in discussion with those schools as well. So there is a plan in place for those students to still be counted and being able to get their work through distance learning.
Okay, thank you, Tina.
Okay, back to, I do have a motion and a second in reference to this lockdown resolution. Do I have any more questions or comments pertaining to it?
Chair.
Comment.
Okay, hold on. I just got the list of names. Go ahead, Councilwoman Mills.
Thank you, Chair. I do believe in their plans there is 3 separate budgeted amounts.
Stand by, Councilwoman Mills. Councilwoman Little Hawk Weston, your mic is hot.
Okay, thank you.
You may continue.
Thank you. So I do believe we may need to pull up those budgets again, because if they're over that 250 threshold for COVID, then those have to be council approval. The attorneys can correct me if I'm wrong, but I'm pretty sure we will have to pull those up, because I think one was below and the rest were above. That's my first comment. My second comment is this resolution that we're getting ready to vote on from a Friday to a Friday. I just want to, the COVID task force, I know they're probably already aware, but just that, we have Halloween coming up next Saturday, and then the tribal elections and national elections on February or November 3rd. So I really feel like, and this is probably something that can be tasked with the COVID task force, with the executive board, making sure we get adequate safety plans in place. I know Pine Ridge District was working on getting kind of some helpful guidelines or something for Halloween, and if we're looking at a lockdown and then coming out of that lockdown next Friday, I just worry. And when we've talked about it before, the mass exodus, or however you want to call it, but we got to figure out a way to come out of these in a safe way. So if the task force can consider that, but that was just my second comment. But I do believe the budgets need to be approved here today. Thank you.
Thank you, Councilwoman Mills. iPad 021, is that Councilman Gibbons?
Hey, I want to say, guys, that the people who want to vote early at the national and not stand in line, that's it's gonna hurt. But the task force, go get them.
Councilwoman Bearkiller, did you still have a question or no?
Well, I was just gonna talk about that food issue. We just now sent something back to finance, overdose, and so I think if we're gonna approve, I thought the ordinance that I motioned for went through, it passed, and all the plans that Ms. Red Owl had was all a part of that ordinance. So coming back to a resolution and approving another plan, I'm kind of wondering why the attorney was presenting it that way. But I think we need to see what finance is going to do, because there's the resolution from Wakbamni is asking for money directly to the districts. And so that's where I'm wondering if the plan that Kina's talking about will go forward, or is it going to be the plan that is going to be coming in finance? So that was my my question.
Okay, so that plan hasn't been presented yet. It was presented partially to the Crazy Horse Planning Commission, and then it was discussed here. But I just figured if I don't know if we can bring it back at the next agenda after this meeting, if that's what we want to do, or if we want to allow that time for her to do the presentation to council. But I just figured we already sent it back to finance for discussion, so we could take all the time to do that there. I'm not sure. That's up to you, council.
Question.
Go ahead, Councilwoman Little Hawk Weston.
Thank you. I think the task force presented us a budget on the food plan. And I think that what our district presented was something separate. And I believe that needed to go back to finance. And the COVID CARES Fund budget needs to be reviewed. We just can't make decisions without looking at the budget to see what is left. I'm not on finance, but I sure like to get on there tomorrow and see what the treasurer is going to present based on what we spent on this CARES fund money and what we have left, because every district got money. I think they were given 2 million. Then we gave three, the largest districts, 500,000 more. So, all the districts got money for COVID related services. And then the tribe itself had a budget to service COVID quarantine families, people that were in isolation, that were positive. So, I'd like to see a budget from the treasurer tomorrow that states the amount of money we spent out of that $64 million. And I'd like to see what is left as a balance. What does he have left that was approved by the council on that budget? What else still needs to be carried out? Because there was some obligations to it. And so we need to look at that. But today we threw in this and we threw in that without ever looking at a budget to see what we have left to spend. So that's why, tomorrow Finance Committee needs to look at all of that. So that just came from one district. You said that they lost quorum. There wasn't action there. But we still need to see what is left in the CARES fund budget with the tribe. Mr. Big Crow needs to probably give us a budget. He did send it to us, but I cannot open it. It's under Windmill. But I will eventually open it here. He sent it again under a PDF file. But again, I'm just saying, Council, we need to look at the budget and see what's left. Because if you remember, we approved a budget already and obligated all the money there. But now you guys are throwing in all of this stuff again. Remember now, we don't forget about the people. That's why we gave money to the districts. We always get accused of not taking care of the people, but you know what? We have been from day one. So I just want to say that tonight or this afternoon. So Finance Committee needs to get the budget, look at it and see what was spent and what's left over to when we're asking for all this to be reimbursed and paid for. CARES Fund dollars said CARES Fund is to be used for COVID related, positive, isolated, quarantine families. Are we not forgetting that? Yes, we all agree that our general public needs help. I brought that up in numerous task force meetings. But again, we need to look at that separately. And we need to ask that of our districts also. Because we keep making this treasurer modify the budget. But we need to start questioning some of these things. I don't sit on finance, but I do talk to Jackie quite a bit because she sits on there. So let's start doing that. Let's not confuse our people here. Thank you.
Thank you, Councilwoman Little Hawk Weston. And Council, I do believe we did it right. We took the motion. You guys, I acknowledge the motions. It went back to the committee, which is the process so we can have all this discussion. You guys can question the treasurer. You guys can look at budgets, make modifications, or whatever needs to happen. So I don't know. I think they lie where they're supposed to lie right now, which is within the committees. Everything was sent back. We're staying on track with our agenda on what this meeting was called for today. So at this time, I'll turn it over to Councilwoman Whitehorse.
Thank you. I just wanted to, I agree with Sonia. We need to follow the process. And so I just wanted to reiterate that my motion was to approve the plan to change the date from Friday to Friday. And the food budget that was presented along with the plan is separate, and the one Mary presented was sent to Finance Committee, and the one that Rayanne presented would have to go to XB. So my motion is just for the plan and the lockdown, and can we run it now? Is my question.
Okay, I have one more council person hand up, which is Councilwoman Sears.
Yes, I agree. Just what Cora said. We just need to run this vote and we can hash out the food part of it, the plans with the motion that was taken tomorrow.
Okay, thank you. Madam Secretary Tulans?
You have Mason Bickrow with his hand up and Cindy Geigo with her hand up.
Okay, but before I go to them, who did I already acknowledge for the motion for this lockdown resolution?
You have Lydia
record that?
Bearkiller. Yes, Lydia Bearkiller as the motion maker with Garfield Apple as the second.
Okay. Treasurer Bickrow.
Okay, so yeah, I was just going to explain, I did send out the trial balance that I got from Casey this morning. And then I also will have the preliminary report plus the council report for tomorrow as well. So I'll send those all out as PDFs. I know someone said, I think Sonia said it was Windmill, but it's still a PDF. You just have to download your a PDF reader and you can read those reports. So yeah, and you're right. We have to deal with this in finance tomorrow. We'll go ahead and I'll send out the current budget here in just a few minutes and stuff. We are overspent in there, and then all the money is basically, spoken for. Unless we get that extra money we get, from the last portion of the CARES Act, then that will still need to be modded in. But we don't know that amount yet as well either. I know Jennifer Barriegel's on here, or even Lisa could maybe find that amount of what we're going to be getting, if anything. So. But yeah, we'll take care of everything in finance tomorrow.
Thank you, Treasurer Bickrow. Before I run this motion, final comments, or the last hand up is Ms. Gallego, the Madam Chief of Staff.
Hey, so my question is, okay, we did submit a budget from the task force. It had 3 different dollar amounts, and the reason why it has those 3 different dollar amount is to have some options on what we can afford to do, right? So those 3 different dollar amounts are in there, and that all goes back to what the budget, and that all has to be hashed out during the finance meeting. But my question in regards to that is, I know that the Wakbamni president did mention like giving money to their constituents and having that reimbursed, and I know that was a resolution that had gone through. But a food for thought is that if we do that, if that motion is passed, then does that kind of, we're not doing both, and then you have to really think about what the districts are already doing, because you have Oglala district, they're already ready for a lockdown. They have purchased food for 500 and I want to say 26 homes. So they're all ready for that. Lake Creek District already has their plan in place on how they're feeding their relatives in that district. As I mentioned before, Pine Ridge Village needs some extra support because they have so many people in their district, and so every one of these districts have plans. Some of them have included in case of a lockdown, or they've reallocated their budget to accommodate those individuals, accommodate a lockdown. So we just need to be perfectly clear when we hash this out tomorrow, if we're going to go one way or the other, because even if you do the vouchering system or you give individuals checks, do those individuals have a ride to the store? Can they get their food purchased in time? And how would that work for those individuals that don't? I know each of these districts also know their constituents better than we do at a tribal level. So they're the ones who are going to be able to better answer that within their community. So they would know who cannot get out of, go shopping. We have a lot of them in our districts. A lot of times food gets delivered to the CAP offices, and then it doesn't get to the ones that actually need it because they don't have a car to get in town. And if they're fortunate enough to have day laborers within that district that do get that out to them, then that's great, but a lot of them do not. So the plan that was presented by the task force covered all of these various different areas, because everybody kept they were like, well, what about this and what about that? So I just wanted to share that. Tomorrow, I know this is all going to be hashed out, so I will end there. Thank you.
Thank you. Madam Secretary, call for the vote, please. Again, this is for the lockdown effective Friday at 10 p.m. to Friday at 6 a.m.
Mr. Chairman.
Yes, sir. Councilman
I
Dillon.
am back. My phone died and I finally got it back up, so I'll be voting.
Okay. Thank you, Councilman Dillon. Madam Secretary.
Okay. Jim Meeks. Jim Meeks. Dwayne Yellowhawk.
Yes.
Dwayne Yellowhawk.
Yes.
Thank you. Garfield Apple. Garfield Apple. Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross.
Yes.
Sonia Little Hawk Weston. Jackie Sears. Vincent Tulance.
Yes.
Craig Dillon.
Yes.
Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentina Mardanian.
One more.
Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Chancey Wilson.
No.
Philip Goodcrow. Philip Goodcrow. Randy Laysbad.
No.
Richard Greenwell.
No.
Richard Greenwell. I didn't hear you.
No.
Thank you. Nakina Mills. Robin Tapio.
Madam Chair, I had a disconnect there. Can you restate the motion, please?
Is to approve the resolution for the lockdown with the date beginning October 23rd through October 30th to coincide with the curfew hours.
Yes.
This is Garfield Apple. I vote no.
Didn't he second that?
Yes, he did.
Who did? I did?
Yes, you seconded it.
You sure did, Councilman Apple?
But I could still vote no, can't I?
I guess you did, so I'll acknowledge your vote as a no.
15 yes.
Okay, thank you.
15 yes, 4 no, 0 abstain, 2 not voting.
Okay, motion carried. Do we have anything further?
I have a question.
Motion to adjourn this meeting.
Councilwoman Merdanian?
So during this lockdown, can we continue to have our council meeting next week? And I just want this out there. So are we going to have our council meeting, our constitutional council meeting scheduled for next week?
Yes, we will. It's via Zoom, so it doesn't, just because we're on lockdown doesn't mean we can't have a meeting.
Okay, I just wanted that out there because there's a lot of questions. Okay, thank you.
Yep.
Tina, I'm also working with the standing committee secretaries because we're finalizing the agenda. And so we always email everybody anyway. So they are emailing stuff into me and I'll email them out to you guys.
Okay, thank you, Miss Stacy.
Did you get my motion?
I heard you, Councilman Gibbons. Madam Secretary, did anybody send you stuff for a secondary meeting after this special pertaining to the lockdown for some time-sensitive issues?
Yes, I received an email from Gracie the day before yesterday regarding emergency items that needed to be added to the agenda. One was regarding Pinnacle Bank, and the other one was a Spectrum update regarding internet services.
Okay, so we have those two to put on for an agenda after this meeting?
Correct.
And I'm sorry, Jennifer Hughes was asking about the vaccine letter that's due today.
Okay, we'll put that on there as well. If you can let her know to be prepared to make a presentation or answer questions from the council.
Shall I send her the link to this meeting?
Yes.
Thank you.
Okay, Mr. Chair, I'll motion to adjourn this meeting.
You could second I did acknowledge Councilman Gibbons' motion to adjourn this meeting.
I'll second.
Okay, second by Councilwoman Tapio. Madam Secretary, call for the vote, please.
Jim Minks. Dwayne Yellowhawk.
Yes.
Garfield Apple.
Yes.
Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross.
Yes.
Sonia Littlehawk Weston. Jackie Sears. Vincent Tulance.
Yes.
Craig Dillon.
Yep.
Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentina Merdanian. Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Chancey Wilson.
Yep.
Philip Goodcrow. Philip Goodcrow. Randy Laisbad.
Yes.
Richard Greenwell.
Yes.
Nakina Mills. Robin Tapio. Robin Tapio.
Yes, can you hear me? Yes.
Okay, I got you.
Yeah. Okay, thank you.
Yeah, 19 yes, 2 not voting.
19 yes, 2 not voting. Motion carried. We'll adjourn this meeting, special meeting in reference to a lockdown at 15:50 hours. And then we do have some emergency items that need to be dealt with today for council action. So I'll call us back to order at 15:50. Madam Secretary, roll call, please.
Jim Meeks. Dwayne Yellowhawk.
Yes, but how long is this going to take? Another appointment?
Garfield Apple.
Here and ready to go.
Glenn Gibbons.
Here for 200.
Lydia Bearkiller.
Here.
James Cross.
Present.
Sonia Littlehawk Weston.
Here.
Jackie Sears. Jackie Sears. Vincent Tulance.
Here.
Craig Dillon.
Yo.
Cora Whitehorse.
Here.
Valerie Janice.
Here.
Valentina Merdanian.
Present.
Ryan Jumping Eagle.
Here.
Bo Little White Man.
Here.
Chancey Wilson.
Here.
Philip Goodcrow. Randy Laisbed. Richard Greenwell.
Here.
Nakina Mills. Nakina Mills. Robin Tapio.
Present.
$16 present, 5 absent.
16 present. Since this was an emergency meeting, I'll excuse those 5 that are absent. Madam Secretary, if you can either share your screen with an agenda or read the agenda for the record so I can get an approval.
I'll have to read it because I didn't modify my agenda to include the vaccine letter. So the first one on the agenda would be the Casino Bill Puyer and Gary Roos regarding the Pinnacle Bank. Item number 2 under ENBD would be the Spectrum update regarding internet services for distance learning. And number 3 will be the vaccine letter by Jennifer Hughes.
Okay, 3 items for the agenda. Can I get a motion to approve?
Motion. Oh.
Motion by Councilman Cross.
Second.
Second by Councilwoman Bearkiller. Madam Secretary, call for the vote, please.
Okay, Dwayne Yellowhawk. Garfield Apple.
Yes.
Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross,
Yes.
Sonia Little Hawk Weston, Vincent Toulant,
Yeah.
Craig Dillon,
Yes.
Cora Whitehorse,
Yes.
Valerie Denise,
Yes.
Valentina Merdanian,
I'm coming up.
Uh-huh.
Ryan Jumping Eagle,
Yep.
Bo Little White Man, Bo
Yes.
Little White Man, Chancey Wilson,
Yes.
Richard Greenwell,
Yes.
Robert Tapio,
Yes.
unanimous, 16 yes.
16 yes, unanimous, motion carried. Item number 1, Councilman Cross, I'll turn it over to you.
All right. Thank you, Chairman Brenner. At this time, I'll turn it over to Gary and Bill, whoever wants to go first. So, and they'll explain what type of action council needs. So, Gary, are you on?
Yes, I am, James.
Okay, I'll turn it over to you, Gary.
Okay, I don't know if Bill's on. Bill, did you get a connection to get on?
Yeah, I'm here.
Okay. I know that it said Pinnacle Bank, which is a key part of this, but I need to give you a little background prior to talking about Pinnacle Bank. At the present time, we have at Shakopee $404,930.47. And that is in the reserve account and the other special account that Shakopee is holding. The reason those numbers are down are because we have made every payment in the amount of $289,000 and some odd dollars and cents. We've made every payment. And since March, we have made the payment that the casino always contributed, which was we paid $140 and the casino paid $149. So the tribe has paid the entire amount, and we're down to that $405,000 figure. On November 4th, they will take out $289,000 and some odd dollars, which will leave us about $114,000 at Shakopee. We will not be able to make our December payment. I don't know if they will, but they definitely can call the loan in default. I was asked by Chairman of the EB&D, Mr. Cross, if I would speak to Joe Dean, which I have on 3 different occasions. And one of the questions that I was proposed to him was, would Shakopee consider re-amortizing the debt? And I've never received a yes or a no, but basically I've received a no. He wanted to know if our casino was open, why it wasn't open, when it will open. He said the business council was concerned about that. He offered the assistance of Shakopee's people. He said their casinos have been open since May 26th, and they've had less than 10 COVID cases, which I told him his area was totally different than ours. But anyway, he wanted to know those answers, and that's what I told him. So come December, we're going to be $174,000 short of being able to make our monthly payment. As most of you know, I was authorized to try and get an FSA loan write-off or a write-down, which I'm in the process of doing. And yesterday, President Bear Runner, you got an email from the State Director of Farm Service Agencies in Huron. They copied several of their people. They copied Superintendent John Long at the BIA and myself. And so this is the letter that I have been waiting for before I complete the application to try and get some debt written off. And this letter from FSA tells the chairman that our payments are due January 1 and July 1 of 2021 in the total of $826,124. Or if you break that up semi-annually, it's $413,062 twice, once in January and once in July. We presently owe $4.8 million in principal, and then with the accrued interest, and then there was some set-aside interest that they never did forgive, we owe $5.6 million, almost $5.7 million to FSA. Because of the pandemic, because of the drought, because of all of the many reasons that we have, I am preparing and received an application for write-off from FSA, which I'm working on, but I was waiting for this letter. Leases are due, I believe November 1st is when they start coming in. We don't know what that's going to be like this year, but again, I'm trying to get the loan written off. If money comes in and we do pay the leases, the second lien on your leases is Shakopee in the amount of $2 million. We don't know if that's going to be coming in or not. I assume it will, but I don't know that. But Shakopee has indicated that they're not willing to re-amortize the debt. So Pinnacle Bank still is willing to loan us money. The last time we spoke with them, and I think Bill can address that better than I, but the last conference call I was on, they were willing. They were asking that the tribe sign the letter that I believe all of you have that came from Pinnacle Bank. It was a several-page letter, and Attorney Jennifer Bear-Eagle has made several changes to it. And if those need to be explained, I think we have, but if they need to be gone over again, we'll have her do that. But in the letter, they wanted a $10,000 payment to process the loan, which I understand Mr. Puyer has paid that from the casino. They also wanted a real estate appraisal, not on the casino property itself, but they wanted a realtor to appraise and give them appraisal values for 80 acres, 160 acres, 320 acres, and then an average of what grassland, like where the casino is sitting, is worth today. I was authorized to work with Share Real Estate, Barbara Share. She's the same one that did the Prairie Ranch Resort land appraisal for us. And I did receive that appraisal yesterday. I've emailed it to Mr. Puyer. So the conditions that we were supposed to meet, including sending current financials and financial information to them, that has been completed. I believe the checklist is done. The only thing is left is if the tribe wants to pursue this loan with Pinnacle Bank, we need to sign this agreement. And I think the best case scenario that we could get is that we would close the loan within 30 days. I think that's best case. But now I'll turn it over to Bill or to Jennifer. And then, do you have any questions that you want to ask me about the numbers and the correspondence that I've had with Shakopee and with the bank in Williston, North Dakota, which is the trustee bank for Shakopee? Does anyone have any questions on what I've said so far?
Mr. Chair, I have a question, but I think it's more directed for the superintendent, if he's still on.
Okay, go ahead, Councilman Wilson.
My question is, I've been getting a few phone calls that a lot of these permittees haven't received an invoice to pay the tribe or pay the BIA for the lease income. So is that going to set us back further if all the invoices haven't been dealt out to the permittees to pay their invoices? And there's been quite a few of them calling here the last couple of weeks that they haven't received a bill from the tribe for their pastures, and they was wondering what was going on. So if they haven't received an invoice, we're probably not going to get paid until they receive an invoice, I'm guessing. So I guess my question is for the superintendent, if when and if all the range units will be billed.
Thanks, Nancy. Okay. Yes, Chancey, we are working on the invoices. We had to wait, every time we do the letter informing the tribe that they're considering increasing the rates. This year, the rates did not change, but we still have to wait for the tribe to appeal. And that 30 days or 45 went by. We didn't hear from the tribe, so we started getting the invoices out. So we are getting them out. It's our intention to have everything out in the next couple of weeks before the end of the month. And the folks that we've gotten them back from have been paying online. So we've gotten some payments already back. There's folks that just want to do the check or the money order thing, so that takes a little longer. But the majority of the folks that are contacting us have been paying online through pay.gov. So I'll get you guys next week on how far along we are with the remaining ones, Chancey. But if folks have any questions, they can call me, and I'll get touch base with our realty staff to see if theirs has been completed.
Okay, thank you. That was just my concern, because if the tribe hasn't even received the lease income yet, that's gonna leave the coffers dry in a lot of areas come November 1st if the invoices ain't completely out. So, all right, thank you.
You bet.
Mr. Chair, this is Bill.
Go ahead, Bill.
Okay, I just want to go over some things here with the council. And thank you for adding us to this agenda, having a special meeting. First of all, the Pinnacle Bank, once we pay off Shakopee, it'll be better rate. Our payments will be lower per month, and the term will be 5 years. They're going to lend us $16,580,000, and the payoff of Shakopee is $14,153,164 as of October 4th, and that will increase by $289,000 or so by November 4th payment. We need those payoff difference dollars that will go to the tribe, and the tribe will transfer it to the casino. We need those payoff dollars to pay off the First National Bank of $1 million, $800,000 for accounts payable, such as including insurances, utilities, and of course $530,000 to replenish the cage. We basically need these dollars to reopen whenever the tribal council decides that we reopen again sometime in the future, when this COVID thing hopefully gets under control. So basically, all we need is your approval today for the commitment letter so we can move forward to get the final loan document completed. That will again come back to the full council for final approval. So basically, this commitment letter just gives us the authority to move forward to complete this loan agreement document, the loan package itself. Any questions?
Madam Secretary, do I have any hands up?
Mr. Chair?
Yes, you have Chancey and Robin.
Mr. Chair, I just need one more thing before questions, please.
Go ahead.
So basically, I need those $2,580,000 $426,836 plus the $289,000 for November to be added into the agreement to place the $1.8 million that's originally in there. So I need that to be included in the amendment, into the agreement as an amendment once a motion is made to approve. Thank you.
Thank you. Councilman Wilson, did you just not lower your hand or?
Yeah, I just forgot to lower my hand. Thank you.
Okay. Councilwoman Tapio?
I think mine was when Gary was talking. I had a question about did he say we were late on the FSA loan also?
No, Robin. May I answer that?
Thank you. Thank you. That's all. Yeah. I just thought you said we were late on FSA. Thank you.
No, we're not. It's not due till January 1st and July 1st. We are not delinquent.
Okay, thanks.
Okay, do I have anything further from Tribal Council for either of those two or for the action?
Question. I had my hand raised.
Yes, Councilwoman Little Hawk Weston, go ahead.
Thank you. So Bill, what you need today is council action on the 2 million you said. Could you repeat that number again?
Okay, what I need is the $2,426,836 plus the $289,000 that will be paid in November. I need those total numbers added into this particular commitment letter to replace the $1.8 million that's currently shown in that letter. And also, I just need this commitment letter approved by the tribal council so Gary and I can move forward and finalize everything pending with Pinnacle to buy out Shakopee. So once that document is complete at the bank level, it will be returned here to the tribal council for final review and approval.
Okay, so that was just increasing the amount from the 1.8 million, right?
Yes, because we need those dollars because we've unfortunately acquired some more expenses since we've been shut down. We have some accounts payables that are due, and of course we have our insurances and our utilities. We have to replenish that cage. The $1 million that was originally borrowed from the First National Bank covered our COVID supplies and paid our past due insurances. And I had to cover 2 payrolls in September when we were open until we closed again. And there's $200,000 left of that original $1 million in the bank. So like I said, this 2.4 plus the 289 will be a big help for us to reopen someday in the future when council makes that decision allowing us to reopen. Thank you.
So, Mr. Chair, the amount, Gary, with the increase, do you have the number? Is it around 2,715,836? Is that the number that the total number? Bill, Gary?
Yeah, it'll be $2,426,836 plus the $289,000. That'll be the figure that we need to be. I'd like to see admitted into the letter, the current commitment letter.
No, I'm just trying to get the total amount. I'm coming up with 2,715,836. Is that the amount that we're requesting for?
Yeah.
I'll motion for that, Mr. Chair, so that we can just be ready for the future of the opening. Whenever we're ready to open it, I guess we just need to at least plan ahead.
Mr. Chair, this is Gary. Could I say something before you run the vote?
Okay. Go ahead.
Sonia, just to make sure that everyone's on the same page, you're not voting on 2.4 million, going to the casino. That's part of it. But what we're actually voting on is the commitment letter to Pinnacle Bank of the 16,580,000 that Bill's talking about, that is the amount of money that we would be borrowing. And of that, the 2.4 that Bill's talking about would go into, he's asking that be part of the casino money, and which, they would pay off the First National Bank the $1 million, and he's asking for the difference to go to the casino. I think I said this before, but I want to reiterate it again. The tribe has made all of the payments on the Shakopee loan since March. And, they've paid the casino's portion. The tribe was to pay 140, the casino 149, but since they've been closed, they haven't been able to pay anything. So, I don't know how this would ever work out, but it is your casino, but the casino has not been able to contribute anything since March. So, that's something that you may want to consider too at some point. But the main thing is, Sonia, what we're asking for or what we're needing is a vote from the council to approve the letter of commitment from Pinnacle Bank, and then with that, they will go ahead and pursue the guaranteed loan. And once that's done, we'll pay off Shakopee, and then this difference in the amount that Bill's talking about, 2.4, that's excess after we pay off Shakopee. So I just wanted to clarify that. Does that make sense, Sonia?
Yeah, that makes sense.
I just want to reiterate on that. Basically, what that is just the loan amount and the payoff difference to Shakopee, and we just want that entire difference, including $289,000, to be changed in that letter, that commitment letter. And what will happen? That'll be transferred to the tribe, and the tribe will transfer it to the casino. So I just want that in there. And once you approve the commitment letter with that change, then that's all we need.
Okay, Jennifer Berrigo.
Yes, thank you. As Gary said, this is a conditional commitment letter. So what you're being asked for is to approve a conditional commitment letter. This is not the actual loan agreement or promissory note. This starts the process to move towards closing. The conditional commitment letter is based on the financial and other information that we supply to the lender. So in the end, there is going to be the final loan itself is going to comprise of several documents, and hopefully that will happen. If you move forward, that would be at closing. So that's going to be the loan agreement itself, the promissory note, any other security agreements or assignment documents. That's going to be all included in the loan package. This today is just this conditional commitment letter to start the process. I just want to point out that what we were told by Pinnacle Bank is that they're seeking to basically enter into the shoes of Shakopee. So whatever setup we have with Shakopee in terms of how that loan is paid off and their position with regard to the assignment of rents and leases and income, they're just going to step into whatever role Shakopee has, and that's what they're seeking to do in this. So we were told that all of the other terms of our current Shakopee loan will be mostly the same. Obviously, our interest rate will be different, but as far as how it operates and how the money is paid, they're just seeking to get what Shakopee has assigned to them. So the goal is for it not to be substantially different from the setup that we have now. And I don't know if Gary or Bill has any other information from Pinnacle Bank on that, but that was the understanding that I received from them. And then the other thing to point out is, like the Shakopee loan, this is in the Shakopee loan, but I have to point it out to you, like the Shakopee loan, this commitment letter has a section on dispute resolution that does call for a limited waiver of sovereign immunity of the tribe. What they did was they took the language, or our discussion was that they were going to take the language for the waiver that was in the Shakopee loan and apply it to this. And so just keep in mind that if you approve of this, it does include that limited waiver of sovereign immunity. I believe that they changed a few things, such as the Shakopee loan had governing law that was Minnesota law, and for whatever reason they would change it to South Dakota law, except where federal law may apply. Jurisdictions, it calls for arbitration proceedings in federal courts of South Dakota, and anywhere that said Shakopee tribal courts changed to Sac and Fox tribe of Mississippi and Iowa. So where it says Shakopee, they put their own tribal courts in there, or courts can be brought in Oglala Sioux tribal court. But just, it's very important that you are aware that that is what is included in here, and that's because that was what was in the Shakopee loan. Thanks.
Thank you. Thank you. Councilwoman Merdanian?
So my question goes to Attorney Bear Eagle, and regarding the similar agreement, does that mean, having the two pots of money that we're paying into as a part of this agreement, and because of the detail of what's being requested in this conditional commitment letter, I'm wondering, shouldn't there be a resolution that spells it out in regards to what we're agreeing to in this conditional commitment letter?
Certainly they're approving this conditional commitment letter. There certainly should be a resolution that authorizes the president to sign it. But again, I do want to point out that this is not going to be the final step in the process. It is, there's still all of the different closing conditions need to happen, and the tribe needs to complete our loan application and signing the promissory note. So that's going to be the final steps. But yes, it would certainly make sense to have a resolution that authorizes the president to sign the conditional commitment letter. The big thing that this would allow the parties to do is to move forward with actually getting, as Gary said, getting that loan, starting to find that loan. That loan guarantee.
Yeah, I understand that. I'm just saying, if they're just coming into the agreement as Shakopee put in place, we're still having to abide by those strict mandates that they had put in place, correct?
So in terms of how the payments are made, that's my understanding that yes, it's going to be the same with the two pots of money, part of the loan being paid by the tribe and part being paid by the casino. I don't know if Gary or Bill was told differently, but that was my last understanding from Pinnacle Bank, is that they intended to keep much of the process the same. They did tell us that they would not charge all the same fees or as many fees, but it was their intent to just to step into the role of Shakopee.
Tribal council, you need to be aware that we pay 6.5% interest to the Shakopee tribe. This will be reduced substantially, I think, to about 5.1 or 5.2%. So that's significant, and it will save dollars each month. And like I said before, the term will remain the same. I believe it's 5 years.
Bill, may I speak, please?
Yeah.
Go ahead, Mr. Roos.
Bill, it's not 5.1 or 2, it's 5.5. And yes, they are expecting a shared agreement between the tribe and the casino to make payments. The payments will be less, And they even talked about to me that they could extend it out a couple of years longer if we needed to lower the monthly payments. And then I have another question, and maybe Bill, you and I haven't talked about this, but I was asked this question. If you get the 2.4 million, and I know we pay off First National Bank of $1 million plus interest, and then I don't know if you're going to apply for that tribal business loan that may be coming, or a grant, excuse me, not a loan, a grant in the amount of $500,000. If you get that, plus you get this difference between the payoff of Shakopee and what is going to be proceeds from the loan, that is going to exceed the amount of budget that you had proposed unless the budget has changed. And so the question was, will you reimburse if there's extra money there? If you get that $500,000 grant, will you reimburse the tribe some of the money that they have paid since March for the casino?
Yes, we can discuss that. That's a strong possibility, yes.
Okay.
Of course, I think everything's contingent on that grant program being approved by council. So,
yeah, I understand. Okay. Thank you, Bill.
Thank you. Councilwoman Sears?
Yeah, Bill, my question is, what is the balance of the Shakopee loan now?
okay, the payoff right now is $14,153,164. That's as of October 4th. And it should go down by another $289,000 on the November 4th payment.
But Bill, remember, of that 289,000, about 90,000 of that is interest, and only about 200,000 goes to principal. That whole thing doesn't.
Yes, so I understand that. Thanks, Gary.
Thank you.
You're welcome.
Councilwoman Merdanian, was your question answered about a resolution pertaining to this?
Yes, as the attorney did allude that we do need a resolution to sign that letter of conditional commitment. And with that, it spells it out, what we're agreeing to in this commitment letter. So with that, I know it's to begin this process. However, I think it's important and it's imperative that we do have it in writing.
Mr. Chair, can I suggest something?
Go ahead.
I know you're having a constitutional council meeting next Tuesday. Perhaps that'll give Jennifer time to draft a resolution, and of course this commitment letter can be attached to said resolution and be presented to council on Tuesday. Will that work?
I would make that motion that it be prepared and presented at council.
Second.
Okay, so wait, Councilwoman Little Hawk Weston, you did make a motion to approve at the beginning, so do you withdraw your motion and let Tina make her motion?
Yes, I'll withdraw my motion because after he explained everything, Mr. Roos, I think we need to get what Tina's saying. Just get everything in the commitment letter and whatever needs to be put in writing, and bring it back to the council meeting.
Okay, so at this time, Councilwoman Merdanian, maybe I'll let you state your motion for the record and what you want.
Motion to have Attorney Bear Eagle draft a resolution detailing the particular amounts requested by the casino for the payoff and the loan payoff and so forth, and that we're agreeing to waive our sovereign immunity, and also that we are agreeing to the same guidelines as what was stipulated within the Shakopee loan. I think those things need to be specified within that resolution, and for the president to have the authority to sign off on the conditional commitment letter. That's my motion. And to send it to council meeting, regular council meeting.
Second.
Okay, so I got a motion by Councilwoman Merdanian, second by Councilwoman Little Hawk Weston. Madam Secretary, call for the vote, please.
Dwayne Yellowhawk, Dwayne Yellowhawk, I didn't hear his vote. Dwayne Yellowhawk,
Dwayne's one that asked to be excused, Stacy. Oh,
he's online, but I can't hear his response.
Okay, I said yes.
Yes.
Yes, his response was a yes.
Garfield Apple, Garfield Apple, Glenn Gibbons,
Yes.
Lydia Bear Killer,
Yes.
James Cross,
Yes.
Sonia Little Hawk Weston,
Ah.
Jackie Sears,
Uh-huh.
Vincent Tulance,
Yes.
Craig Dillon,
Yes.
Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentina Merdanian,
Uh-huh.
Ryan Jumping Eagle,
yes.
Bo Little White Man,
Yes.
Chancey Wilson,
Yes.
Richard Greenwald,
Yes.
Robin Tapio,
Madam Secretary, could you please restate the motion? I had to step out for a minute.
Valentina, can you assist?
Robin, the motion is for Attorney Bear Eagle to draft a resolution specifying the details within the conditional commitment letter and move it to council, regular council meeting.
Yes.
$16 yes, 1 not voting.
16 yes, 1 not voting. Motion carried. Thank you, Tribal Council, and Mr. Roos, as well as
Mr. Chair, thank you, and Mr. Chair, thank you, and thanks to Tribal Council. Thank you.
Yes, thank you, Mr. Puyer. Madam Secretary, item number 2 on the agenda, please.
You have the spectrum update, committee action from 10/9/2020, motion by Ryan Jumping Eagle, seconded by Sonia Little Hawk Weston to move the contract with Golden West of their services to help the students on the Pine Ridge Indian Reservation who may not have access to internet services, Wi-Fi, for their distance learning, and that the money or the funding comes out from the CARES Act funding, that this motion be forwarded onto the Tribal Council meeting.
Okay, Councilwoman Little Hawk Weston, or somebody who's going to make the presentation to council, or do we just want to take action?
Is that coming from the EB&D, right? This item?
Correct.
Yeah, I think this also coincides with the Education Committee. And maybe Ms. Merdani could jump in here, but I sat in on the Education Committee meeting Monday, and they did bring this up to Golden West. And I know the EB&D committee did take action to forward this to council so we can get, he needed approval of a contract where they could start working on trying to provide, what is it, Tina? Is it Wi-Fi internet services?
That's correct.
students that are in areas that don't have it now due to the virtual learning. So that was why we forwarded it to tribal council.
And I believe another part of this is the spectrum piece. And Mr. Ernest Weston was to bring the amounts to committee EB&D regarding the cost that were associated with getting our own towers. The idea is to be able to diversify the services, because with Golden West, they're not going to be able to get cable laid right away in some communities or upgrade of the wiring. So with that, it's important that we make sure we're getting the services needed for the distance learning. This contract first came to Education Committee, and we discussed it at the joint meeting, because the reality is with Golden West laying new cable, there's going to be needing easements. There's going to be a lot of other underlying issues that may create hurdles and obstacles for providing the services to our students. All because of the shelter in place, all of our schools within the reservation are distance learning, and they're struggling to provide that educational service to students who don't have internet access. There are some communities with very limited access. So then they're taking out contracts with like HughesNet, and those are very expensive contracts. They run around almost $160 for that. And so the question was in Education Committee is, where is the Spectrum project? And why aren't we moving forward, and why aren't we investing in our own services here on the reservation and our own infrastructure? Because what Golden West puts in place, Golden West owns, and not the tribe. And we feel that it's important to not only cover the services being provided by Golden West to our students, because a lot of them can't afford it, but also to be able to provide those services. And there was discussion about just giving students, divide up the money, the $1.9 million to all the students and on the reservation, but then that doesn't last very long. So to make sound decisions, I think it's important that we also invest in our own infrastructure, which is the Spectrum project. So I know Mr. Ernest Weston is on there, and I would hate for us to agree to a contract when we don't really have a set price, because the schools are getting the location to Golden West. Golden West was to get us a map or an idea, a figure. And that was our discussion on Monday as to what the cost was going to be. And, $1.9 million is going to go fairly quickly. And that's why I think it's important we also get the Spectrum project budgeted in within this $1.9 million from the CARES funds. So I'm hoping if Mr. Weston is on, can he share with us some figures so that this $1.9 million is not just going to Golden West? Ernest, are you on?
Hello, can you hear me?
Yes.
Okay, thank you, Mrs. Merdanian. Tribal Council, I think you should have received in your emails a document from myself, which included budgets for some towers. And at the last joint EBD and I think it was land last week, we talked about doing our own networks. And so I put together a budget. And in doing this budget, we identified 12 communities that either have very limited access to internet or no access at all. And those communities were Retchert Table, Batesland, Walk-Bombing Area, Heisel, Potato Creek, north of Allen, Yellow Bear, American Horse Creek, North Manderson, Georgetown, Lakeside, and Gooseneck. And those communities, Mrs. Brave Eagle from T, she also contributed to that list based on, of course, she works with the students in the schools. So that list of 12 communities, we have a equipment identified that will allow us to go into these communities and do small scale community network builds. And what that means is we'll put up two pieces of equipment that communicate with each other using the spectrum, and that will create internet access in those communities. The communities themselves, some of them are going to require some infrastructure upgrade, such as towers. And those communities that we identified that would, receive a tower first was Retchard Table, Georgetown, Lakeside, and Wackabomini area. And when I say Wackabomini area, that also includes Batesland. So when we were doing the budget, and I had help from MuralNet, who we worked with, all year to submit the license to the FCC for the spectrum. And Danae Wilson and from Facebook, they were lending me their time to come up with a budget. So the cost per tower is $160,000, 123. And for 4 of those would be, $640,000. Now we go back to the community links. For 12 of them, each of them costs about $5,200 a piece. Oh, excuse me, 56. So for the 12 communities to get them internet access would be $135,000. And that total for both of those projects would be $775,492. So in a nutshell, that's what I was able to come up with between Friday and today. I know that moving forward, if we were to do the 12 community hookups, that would happen rather quick in the next 2 months by the end of December. If we were to purchase those in the next 2 weeks, there is some guidelines we have to follow with the FCC to have at least one of those locations up in 2 weeks. So from the time we purchased the equipment, that's the go button to get one of these communities hooked up. And we identified Batesland community as the community to hook up first based on their location, and they do have the greatest need at this moment. So I don't know if there's any questions, but that's what I've prepared and submitted to my committee secretary, and hopefully that got passed on to you guys.
Okay, well, I'll motion to approve and move ahead.
Okay, I'll second.
Approve which one, Robin?
The spec.
Because
Yeah.
because AT&T, they had a presentation on that, and then he's moving his in, so I was just trying to make sure.
Motion by Councilwoman Tapio.
Yeah.
Question, I have my hand up. Can I ask my question?
Go ahead.
Okay. Ernest, I looked.
Cora, you're on the list. Go.
White Horse.
Cora, you could go ahead. I think that's what he's.
Ernest, I looked at your proposal. And what is the total amount? Because your proposal has individual costs, and then there's 12 communities listed. but I can't tell which is which. For the neighborhood solution links, it says
Did she get cut
100.
off?
No, I'm on. Can you hear me? Can you hear me?
We can now. We can now.
I asked what the total amount for the whole project would be for phase 1 and phase 2.
Okay, so phase one's $135,000, and that's the immediate community hookups. The second part to that, though, because some of those communities are going to require a tower for to sustain this, and that's the 4 that I mentioned, and that is $640,000. So the total of it, $775,492.
Okay. And that would be coming out of the internet connectivity set aside of 1.9, right?
Correct.
Correct.
Okay. I just wanted that clarified because it didn't have a whole total project amount. Thank you.
Thank you, Councilwoman Whitehorse. I did acknowledge, sorry I cut it out of service, I did acknowledge the motion by Councilwoman Tapio. Did I get a second?
I second it.
Okay, second by Councilwoman Merdanian. Do I have any other hands up, Madam Secretary?
Jackie Sears still had her hand up.
Oh, no, I didn't take it down. Sorry.
Okay.
Okay, Council. Okay, if I have no other hands up, I do have a motion and a second to approve. Madam Secretary, call for the vote, please.
Dwayne Yellowhawk.
Yes.
Garfield Apple. Garfield Apple. Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross.
Yes.
Sonia Little Hawk Weston.
Huh?
Jackie Sears.
Oh,
Vincent Tulance.
Yes.
Craig Dillon.
Yep.
Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentina Merdanian. Ryan Jumping Eagle.
Yes.
Bo Little White Man. Bo Little White Man. Chancey Wilson.
Yes.
Richard Greenwald.
Yes.
Robin Tapio.
Yes.
15 yes, 2 not voting.
In regards to Golden West contract, I asked that the Tribal Ed Director, Ms. Dana Brave Eagle, Attorney Adams, along with Mr. Olson of Golden West, figure out an amount. And so, if I need to make that motion and to send it to council, I can do that. Because I think we need an amount. Right now, it's just a scale of what it's going to cost to provide those services. So I feel it's important that we have an amount that comes as a part of that contract of the amount of funds that is going to be allocated to that contract.
Make that motion, Tina.
Well, I make that motion then. And
I'll second.
I have a comment.
Okay, stand by. Let me close out the last motion. Madam Secretary, can you finish what the vote was?
Yes, the vote was 15 yes, 2 not voting.
for the record from the last action? Okay, 15 yes, motion by Councilwoman Merdanian, second by Councilwoman Little Hawk Weston. You had a question?
Yeah, I didn't second that, but I do have just a quick comment for Mr. Weston. You know, you mentioned earlier on the first motion about the contract between Golden West and the tribe. You said something about Batesland, about providing the services out to Batesland. You know, our area of Wakpami on the east side is serviced by the Great Plains, I think out of Nebraska. So how did you meet with them to get you working that out with them?
I have yet to have that discussion with them because of the turnaround time to get this budget in. This is what I brought to the table.
Oh, okay. I just wanted to throw that out there, but I think that the council needs to just know that that area of our district, Wakpamni, is covered by the Great Plains. I think it's the telecommunication out of Nebraska, not Golden West. West does not service that area. So we just need to keep that in mind. I think that's something that has been an ongoing issue within the EB&D, trying to work that through Golden West and Great Plains. So eventually down the road, we need to get that. I think they also want it under Golden West to be serviced. So just keep something in mind in that area so we can get that taken care of down the road. Thank you.
Thank you, Councilwoman Little Hawk Weston. Again, for the record, I said a motion. It was a motion by Councilwoman Merdanian, second by Councilwoman Tapio.
Yes.
Mr. Chairman.
Question.
I mean, yeah, correct. Okay, Councilwoman. Yes, Councilor, then Councilman Dillon.
Okay, so Tina, with what you're putting back out there, is the school's gonna identify the immediate needs of the student? You know, because some of the students do have service, so we're gonna have Ms. Dana do the actual amount per student need, right? For this Golden West contract?
Yeah, so yes, Lydia, the contract right now is kind of like a sliding scale, and they have it around 500. If we agree to pay for 500 users, the cost is around $48 per month, I believe. And I think Attorney Adams is also on, and she's more familiar with this contract is in regards to the cost per student. The contract is also listing other fees that would be associated if they did the hookups. There's already existing users, and so we would also help with those existing users that already have Golden West. We would help pay for that. But at the same time, those that need hookups, we would pay for those. And that's why we're trying to get an amount as to what that cost is going to look like for Golden West. So that's kind of where we are at this point. And Dana is getting the numbers from the schools who already have Golden West. And so that we can start, helping them with those costs as well as those that they can hook up. Lydia.
Okay, thank you. That's what I remember. We talked about that. So,
yeah.
Because the schools got CARES Act money too, remember?
Yeah, and a lot of them spent their money on devices like buying tablets and computers and iPads. And for now, some of them were buying hotspots, which is a temporary fix. And so we're trying to provide a more permanent infrastructure.
We're going to run the vote?
Councilman Dillon?
Yeah, that answered some of my question, but we have people right here in Lake Creek who aren't hooked up, and I want to make sure that they get hooked up because just because it's a non-tribal school, we still have a majority of the students that attend that school are tribal members. So I want to make sure that their needs are met as well. Tina, can you assure me of that?
Well, I know that Ms. Dana has been talking to the administrators at Bennett County, as well as Kadoka, Oryx, who have a large percentage of our tribal membership attending those schools. So we are including them, Craig. They include it in those numbers. We're just waiting on the schools to get us the addresses. That's what we're waiting on. We're not waiting on names and so forth. We're just needing addresses for Golden West for those hookups.
And if that don't come in right away, let me know because we can get those addresses here in town. Because I know a grandmother called me and said her granddaughter was going to need the hookup, but I found out more today than anything about how that's going to happen. So as long as we're covering these areas, I'm ready to vote, Mr. Chairman.
Thank you, Councilman Dillon. Okay. iPhone put their hand down. Madam Secretary, go ahead and call for the vote, please.
Dwayne Yellowhawk,
Yeah.
Garfield Apple,
Capital 101 steps.
Glenn Gibbons,
Yes.
Lydia Bearkiller,
Yes.
James Cross,
Yes.
Sonia Littlehawk Weston, Vincent Toulant,
Yes.
Jackie Sears, Craig Dillon,
Yes.
Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentino Merdanian, Ryan Jumping Eagle,
Yes.
Bo Little White Man, Bo Little White Man, Chancey Wilson, Chancey Wilson, Richard Greenwald,
Yes.
Robin Tapio,
Yes.
14 yes, 3 not voting.
14 yes, motion carried. Thank you, Tribal Council. That concludes everything for the EMBD committee. Next, we have Jennifer Hughes.
Hello, President and Council. Thanks for letting me join this meeting. It's my understanding that the issue came up yesterday at HHS committee, and of course, obviously, the chair, vice, or any of the members can correct me if I'm wrong. But I understood that the committee wanted to prepare comments to submit to the Indian Health Service on its draft pandemic vaccine plan. And thus we prepared draft comments, which you all have in your inbox. I can share the screen if you'd like me to. But the IHS has put together a draft vaccine plan, and it builds from the CDC, the DHHS, Department of Health and Human Services, and CDC playbook that the tribe already submitted comments on. I think it was just last week. So IHS put out a Dear Tribal Leader letter. They only gave a week for tribes to come together to put their comments on the record. And the IHS draft plan has a lot of similar themes as the HHS CDC playbook. I think it's technically the CDC playbook, apologies, but it has a lot of similar themes as that playbook, but it adds topic. And so what we did, frankly, was we took the comments that the tribe approved to be submitted to the HHS and CDC and converted them so that they are applied to the IHS draft vaccine plan. And so largely you have what would be what we put forth to in the other comments. You have the same background. So we're telling IHS, if they don't already know, the background of the Oglala Sioux tribe. We do get into the fact of how large the reservation is. We always start out with the treaty obligations of the United States to the tribe and your members. We do talk about the chronic underfunding of and not adhering to those treaty obligations and the toll it has taken on the tribe and its members, specifically here in terms of healthcare. So this paragraph, we talk about the health disparities of your tribal members. And then we get into what we had as a particular point that the tribe wanted to make, even though the IHS is not talking about having the Oglala Sioux tribe or tribal members or Native folks anywhere, frankly, in this particular draft vaccine plan, to have the tribe participate in trials, like vaccine trials or experiments, to see if those vaccines are indeed viable vaccines. Even though that's not what the draft plan includes, we do include this point, which I understand is important to the tribe, and we included it in the previous comments as well, which is that the tribe is concerned about rushing to get a vaccine together and the safety of that. Instead, you want to make sure that the vaccine doesn't have any arbitrary truncated timelines, but that it's safely developed and is, gone through other studies. And we say flat out that the tribe will not participate in trials, and that you're stating that you have to respect our tribal sovereignty, and the HHS, IHS, NIH, anyone else will not administer the vaccine as a trial to any of your members. As far as the IHS plan itself, draft plan itself, there are some good features. It does talk about the fact that it's a living document. And so we do express in these draft comments support for it to be a living document, meaning that IHS needs to be developing it not only in response to comments it receives from the tribe and others in Indian country, but in response to lessons learned in the science as things unfold still with the pandemic and how to treat COVID-19. We do point out that the draft plan does not make it clear how although it says it'll take into consideration, tribal feedback, it doesn't make clear how it's going to do that in its future adaptations. It just has the comment deadline of today to get tribal feedback, but we know it's still a draft plan. There's a long way to go, unfortunately, in the pandemic. So we want to make sure that there's ongoing communication and tribal involvement. Given that, we're recommending that the IHS has periodic calls, at the very least, with tribal leaders, so that they can share their thinking and tribal leaders can provide input on what's needed and what's the best path forward. Availability for the vaccine, IHS talks in terms of identifying priority groups, but it's not talking in terms, as far as we can tell, of saying that the tribe's population or Native population as a whole will be considered a priority group. It doesn't say that, and so we point that out and make the point that the tribe, we're just speaking, of course, on behalf of the Oglala Sioux tribe, that's for your comments here, but that the Oglala Sioux tribe should be treated as a single priority group. And it makes the argument based on the fact that, given the Oglala Sioux tribal community, given the Oglala Sioux multi-generational families living together, that your community is tightly woven, interwoven. Long story short, we're saying you can't identify some priority groups and leave others out, because that will just leave gaps, even within the households, and certainly within your communities, for those that get the vaccine and those that don't. And so, to be airtight, if you will, we don't use that term in here, but just to explain kind of the highlights, that IHS should deem your tribe as a single priority group. That's what we put in here. We also say that there might be limited quantities. We get that, so identify those with the highest risk. We are saying, given that we tie back in to your health disparities throughout your population, that there is high risk among your membership. Similar to what we said last time, the draft plan talks in terms of vaccines through IHS or through the state. And frankly, we add in that third option of the tribe, participating in the vaccine distribution. And that could be through the tribe's contracted programs from IHS, and also through Oyate Health Center, which obviously the tribe is, a member of. It also, these draft comments highlight and underscore that as tribal leaders, you know your community best, and that the IHS should recognize that. You know your needs best, you know how to communicate with your members best. IHS should recognize that. It also talks in terms of if tribal facilities are to administer the vaccines, distribute them, that there will be these quote unquote COVID-19 vaccination program agreements, but we don't see what those entail, like what the language is in those agreements. That's still in the works. So we just point out that we need more information before we can comment on that. Similar to the other comments, we set forth the logistical problems with the vaccine as we know it. It's going to need ultra cold storage, and it has limited shelf life. That's what we're hearing. And so we wanted to point that out, that the IHS really needs to plan and needs to have a solid plan for how they're going to accommodate those needs for the vaccine in a large land-based tribe such as the Pine Ridge Indian Reservation, where it's going to have to travel, one would, presumably, from the urban area of Rapid City, presumably down to the reservation. How are they going to be able to handle that effectively, given again the cold storage and the limited shelf life? These also say, IHS draft plan talks in terms of point of distribution. We just point out that we want to make sure that that point of distribution is on the reservation and at Oyate, that we have concerns that if the point of distribution is outside the reservation, that won't really do the trick for the Pine Ridge Indian Reservation and getting its members vaccinated. We do actually, support, again, aspects of the plan. One good thing they have in there is that it includes multi-level provider training for the safe storage and handling of the vaccine. And we're saying that that's a really good thing. The broader training among those that would be potentially, those that are in the chain of vaccine distribution or potentially could be, the broader training, the better, the more empowerment into the community for the vaccine distribution. Similar, again, we talk about vaccine tracking, and we make the point that we want to make sure that it is comprehensive, that it is a tracking system that includes data from the state tracking system, so that your members throughout the state, and the fact that your members might travel on one hand to get the first dose. They might get the second dose somewhere else. Same point as we said before, there needs to be comprehensive tracking for this. And we also point out that there are some concerns, though, just because IHS, it intends to implement the data management sections of the draft plan, but that we know that IHS is also modernizing its technology, its health information technology across the Indian health system. So we're just saying we have a concern of whether that those systems are up to the task, and that they frankly have to be, but just pointing it out as a, an obvious point that, IHS needs to get that modernizing done and implemented. So we also say that it doesn't really identify how, if it's working with the CDC platforms, which we think it must, how that will correlate to working with the RPMS, the resource and patient management system, or any other, quote unquote, commercial product that IHS uses for data management. So in the end, it is very similar to what the tribe submitted before. However, obviously specifically tailored to IHS draft plan. And it says, underscoring in the conclusion, that IHS needs to proactively consult with tribal leaders. Tribal leaders are the ones that will be able to say what's needed in their communities, but tribal leaders cannot do that, and tribal members will not be fully protected unless you have timely and accurate information, regular communications with the IHS, and proper recognition and treatment as political sovereigns by the IHS and the federal government. So that's a highlight. I know I talked a lot, and I'm happy to take any questions. It is, again, one of these where if the tribe approves the submission of the comments, we can finalize them on our end and get them submitted today.
Motion to approve.
Second.
Motion to approve by Councilwoman Merdanian, second by Councilman Gibbons.
I have a question. My hand's up.
Yes, Councilwoman Sears.
Yeah, Jennifer, is there a deadline on this? What was the deadline for this comment?
Unfortunately, if you can believe it, it's today. IHS gave 1 week. And so I think I unfortunately was not at HHS yesterday, and so I'm just not sure how much it was discussed, or so I think it's fortuitous, really, that the tribe has this meeting and had a scheduled meeting today to try to accommodate this. But it is definitely 11th hour, and so we did our best to try to tailor it.
So is there language in there that IHS won't provide any vaccines unless they're FDA approved?
There's language that says that we worry that in the rush.
Jennifer?
Yes, actually, I think we could say that up there.
Am I
feel
froze
like
up here, or Jennifer froze up?
Oh, did I freeze?
Did you hear my question?
Yes. Can you hear me?
Yes, you froze up. I couldn't hear your.
Yeah, she's okay.
We do. I don't think we say it as clear as that. But I think we could say that in this area where we're talking about vaccine trials, I think I could just add a sentence that the tribe will not support the distribution of any vaccine that is not FDA approved.
Yes, I think that's really important. And also, because we did have some comments from our research review board that weren't allowed or didn't have the opportunity to be a part of the discussion on this. So I think we need to let IHS know that we have a process and they didn't give us enough time to do that.
I can add that sentence. I'll add the FDA approval right here at the beginning of this point. And I think at the beginning where we're saying just like on behalf of the tribe and we're submitting the comments. I think at the end of that first paragraph, which says what we're doing, I will say the IHS did not provide adequate time for tribes, the Oglala Sioux tribe or Indian country, frankly, to thoroughly review the plan and provide comments. So we asked that there's an opportunity to provide supplemental comments or something like that. Okay. Okay.
So I do have a motion and a second. Madam Secretary, do I have any other hands up?
Mr. Chair, my hand was up. Thank you. I kind of been going in and out too. So, I'm kind of with Jackie on the same page. And I know Jennifer said it is 11th hour, but there was really a lot to this. And I just think that we need more time. I wonder if our attorneys had time to review this. And the other thing, a certain time to look at. I'm just kidding. I know we don't have a Surgeon General, but my concerns are the same as Jackie's. And so have the attorneys had any of the attorneys had time to review this? That's my question.
Yes, ma'am.
Any recommendations?
Well, I think that, I'm sorry.
Go ahead, Madam Attorney Adams.
Attorney Hughes and I did have a chance to discuss the comments. As she stated to council, this is done rather haphazardly, not by Ms. Hughes or tribal council, COU and SEL, but by the mechanism by which they got it to you guys. In other words, they're doing this last minute. And so the tribes as a whole, this is, well, can I put it colloquially? It's shady. So bottom line is the letter that Attorney Hughes prepared reflects the basic concerns in Indian country generally. And we were hoping to get some more specific to Oglala comments done. But I felt that the letter as it's written is accurate. It's good. It'll be timely. It won't be not submitted at all. And unfortunately, that would be the other outcome. I don't know that Ms. Hughes can get I guess you could say, an extension of something that stretches to every tribe that received notice of this activity going on. I just, they didn't, it's so typical, but they did it again. And so now I find that Attorney Hughes's commentary as set forth in the letter is good. The background is well stated. The Oglala are the largest rural land-based tribe. Okay. I don't think people realize just how big the reservation is. And, the statement regarding chronic underfunding of treaty obligations, you couldn't get more succinct, meaning clearer than that. I'm not going to spend 1,000 hours going through each and every provision of this letter, but it's a good one. I think it states the tribe's position, and I'm speaking from a little bit different perspective, because when you look at the draft plan, there has to be something other than just using tribes to test a vaccine that, as Councilmember Sears correctly stated or questioned, is this even FDA approved? Well, none of us want anyone to be guinea pigs. There's a rather sordid history of this in the U.S. government of using underserved or minority populations to test vaccines, and sometimes even spread disease, okay, in order to prove a vaccine. I liked her letter. I thought it was really good and accurate, and addresses the issues that IHS is looking to have addressed.
Councilwoman Tapio, did that answer your question?
Yes, thank you.
Do I have any other hands up, Madam Secretary?
Yes, I have a question.
Okay, Councilwoman Little Hawk Weston.
Thank you, President. I guess first of all, I just want to say that I don't like this Dear Tribal Leader letter because it seems like it's at the 11th hour, Jennifer. That's the first thing, dated October 14th. It's given us, it's like trying to pressure the tribe into agreeing to this vaccination. And it is, the way I'm reading it, it's the COVID-19 vaccination. And I think just, listening to, everyone listens to the news. And to me, I think it's just, and I said it in the HHS meeting, I think we're just like the tribes are being pressured to agree to this consultation with the tribes. But I don't think that, I don't agree with it because it doesn't give the tribes enough time to review everything and make our comments. We need to also hear from the people because, we're getting text messages from the people. And so we need to understand that consultation works that way. We don't just be given something at the last 11th hour to make a decision on it. So I do want to say that our tribe, took a position not to allow for this vaccination to be used on our people, our Oyate, and we did make that clear to IHS. So again, I don't agree with trying to pressure us into doing this right away. To me, I just look at it as a Trump pushing it, and I just don't see it that way. So I really want to say today that we better wait on this. And I know that we do have a research review board, like Ms. Sears mentioned, and everything that's going to be researched comes through that board. So that anything of this nature should go that direction. So we need to just make that clear today that we are not in support of this. So I just wanted to say that because we are also getting messages from our district, our tribal members. And so we can't just, do what Mr. Riaki wants us to do, so, that's what we need to stress in this letter back to Mr. Riaki, Jennifer. But thank you for bringing this to our attention and also putting the letter together on behalf of the tribe, because yes, you're right. We are the second largest land-based tribe in the United States next to the Navajos. And so, we have every right to stand strong and say, no, you're not gonna use our people. I think we need to make that clear to them. Thank you.
Thank you, Councilwoman Little Hawk Weston. Madam Attorney Adams.
Yeah, I forgot to mention one thing, and I echo Councilwoman Little Hawk Weston's comments, and that is this: stateside, where they're testing these vaccines, and I'm going to say alleged vaccines because at this point we don't even know what that entails. But stateside, if you volunteer to participate in the blind studies for these vaccines, you may volunteer, but they pay each person $2,000 to do it. Okay. And that's regardless of whether you get the placebo or you get the real thing. Now, here's the interesting thing. And this is why what they're doing here is so patently offensive and should be to every tribal member in this country. And I'm speaking very strongly for a reason. When the person I am married to, who is an Oglala Sioux tribal member with certain health conditions, applied to do that voluntary study where he would have been paid, it was either $2,000 or $2,500, for the privilege of being freaking injected with something horrifying, potentially. They said, no, you don't qualify because you have X, Y, and Z health condition. Okay. So the idea that everyone would be getting a vaccine, and particularly the vulnerable members of the tribe, would almost be counterintuitive and against what they're trying to do, because stateside, they're not doing that. They're prohibiting people with the classic health weaknesses from doing it. And that's all I'm going to say.
Madam Attorney Hughes.
Thank you, Mr. President. And I've been listening, of course, and I just wanted to, I don't know if anyone can see the screen, but it's hard to do if you're not, on a computer. But so the first paragraph is what it was, which is, I'm on behalf of the tribe, I'm submitting the following comments. It just tells you, it's the opening paragraph. I added a new paragraph that I wanted to read to see if it captures the concerns, at least on the rush. The paragraph now reads, the new paragraph, at the outset, the IHS did not allow the tribe or Indian country to fully review the draft plan and develop full comments. The time frame for submitting comments was far too short for such an important matter. The tribe and Indian country should not be pressured to rush its comments. Time, consideration, and review of the science is needed. IHS needs to slow down and listen to us and our fellow tribes so that it can develop a plan that takes into account all of our concerns and recommendations. The tribe demands that the IHS grant an extension of the comment period. In the alternative, the tribe demands that it be allowed to submit subsequent comments on the draft plan despite the IHS's deadline for submitting comments today. An attempt to try to capture some of the council members' concerns about the rush and the inability really to, study the plan and incorporate all your comments. So I just wanted to make sure you were aware of that new paragraph with hope that it helps address those points.
Thank you, Madam Attorney Hughes. Councilwoman Tapio.
Yeah, Jennifer, what's the so will your comments be taken into consideration, or if this passes, is it a done deal? That's my question.
No, it's supposed to be revised based on the tribal input. That's what they say. So this is their draft plan. And they are saying that it will be where did it say that? Request written comments. The request to provide written comments is a separate input gathering activity. I apologize, I can't find it exactly, but it does say that they will revise the plan based on input. It's their draft.
Okay.
And I think regardless, I guess my recommendation is that if the tribe so chooses, it submit this letter, but regardless, put together, another letter that has additional comments there just wasn't time enough to get into this letter and submit it. You know, I think that regardless of what their deadline for comments are, you know, it's government to government correspondence saying, you know, upon further review, you need to take this into account.
Councilwoman Killer.
Okay, so that's what I was gonna say. Maybe we should do a separate letter to Iaki on this issue, because we did oppose it in the beginning, and then this coming forward is the distribution if and when FDA approves a vaccine, right, Jennifer?
Yes, and
But
I also. Go ahead.
This is basically they're asking for the distribution of, and we're asking for a FDA approved vaccine for distribution, right?
Yes, it goes into a fair amount of detail, their plan, because it does. They're talking in terms of vaccine availability, prioritization of who gets the vaccine, like who gets it first, distribution and ordering of the vaccine, communications about the vaccine and how you get it. So, and data management, and safety and monitoring. So they are covering a lot of different categories. I don't think that they are saying that they're not talking about doing trials. They're talking about how they're going to distribute the vaccine once it is approved. But we do still include in here the tribe's concern that there is a rush to approve. And so that's a concern of the tribes. And you're not going to participate in trials. And you don't support, I just added a flat out sentence that says the tribe will not support the distribution of any vaccine that is not approved by the FDA. Just a one sentence on its own, so it stands out. But I didn't mean to talk too much. I'm sorry, Councilmember. I don't know if that helped.
Hey, thank you. No, that's good.
Thank you. Woman, cheers.
Yeah, I think, like Lydia said, maybe that second letter, I think we need to do a resolution to with that letter on the next one that we do send, opposing this. And also, Jennifer, that vaccine, is that what's it called? Remdesivir or I can't pronounce it.
Remdesivir?
Yeah, that. Is that what they're possibly trying to push through with that?
I don't
There's
know.
Not really anything stated what kind of drug yet.
Correct.
Okay.
This is more.
I thought it was that first one was the hydrochloroquine or whatever it's called.
Chloroquine, yeah.
Chloroquine, yeah. That's the one they were pushing out for trials, but we opposed all of that.
Mm-hmm.
So maybe we do a
resolution.
I think we need a resolution.
Yeah.
Couldn't we just pass it with the amendments Jennifer can add in?
Yeah. But this is just telling our position from our tribe. It's not like we're approving anything. We're just...
Right, this is just their last minute response to their last minute letter.
Yeah, that way they can't say, well, you didn't respond, so... Yeah, so I think that's just all they're asking for. We're not approving nothing. This is just our position as Oglala Sioux tribe.
Correct.
Right. So the vote we're about to run is a motion to approve the comments to be sent in, the ones that were just shared, that were drafted by Madam Attorney Hughes. Motion is by Councilwoman Merdanian, second by Councilman Gibbons.
With the
Madam Attorney, do I have any more hands up?
with amendments, right?
Correct.
Okay.
If there are no more hands up, Madam Attorney, call for the vote, please.
Madam Secretary, you mean?
I'm sorry, Madam Secretary Tulance, call for the vote, please.
I was worried.
Dwayne Yellowhawk.
Yes.
Garfield Apple. Glenn Gibbons.
Yes.
Lydia Bearkiller.
Yes.
James Cross.
Yes.
Sonia Littlehawk Weston. Jackie Sears. Vincent Tulance.
Yes.
Craig Dillon. Cora Whitehorse.
Yes.
Valerie Janice.
Yes.
Valentino Merdanian. Ryan Jumping Eagle.
Yes.
Bo Little White Man.
Yes.
Chancey Wilson. Chancey Wilson. Richard Greenwald. Richard Greenwald. Robin Tapio.
Yes.
I vote yes.
Yes, 3 not voting.
14 yes, motion carried. Thank you, Madam Attorney Hughes. Thank you, Tribal Council. That concludes everything for this agenda.
I have a question for Attorney Hughes.
Yes, Councilwoman Merdanian.
Just a follow-up question. I know in the past that council did take action to file suit on Big Pharma regarding the opioid addiction. And there has been a ruling of $8.3 billion that they'll be paying out, Purdue, on the opioid settlement. So where are we at in that picture?
We are, I saw that ruling. That was just a recent, I think, news event. I am not sure. And I think maybe Jennifer Barrigal, I don't know if she might have more. Actually, we're not handling your opioid suit. We are handling the Jewel litigation. I think it might be, Jennifer might know better, but is it Brendan Johnson?
Yes, it's Brendan Johnson that's handling that one for us.
So I don't want to stage a guess as to where things might stand or how it might shake out for the tribe.
Okay, so Jennifer Bear Eagle, Attorney Bear Eagle, can we get an update as to where we are within that litigation or that settlement, I should say?
Yes, absolutely. I'll reach out to Brendan Johnson and get an update for the council.
Okay, motion to adjourn.
I'll second, but there's also a new CDC redefining social distancing. So I think we need to kind of educate ourselves on those new definition. Thank you.
And hey, I have one more thing. I have one more issue. Is it all right if I speak, Chair? But okay. Well, anyway, I would like to make a motion to send the discussion of the propane payments to finance tomorrow. It's getting cold out, and a lot of people haven't gotten their propane yet. So, I want to make that motion.
I think you just bring it up and put it on the agenda. And
I don't need to make that. Just bring it up
I could
tomorrow.
just go ahead and do it.
Councilwoman Whitehorse, is that already being taken care of in finance?
No, but we can bring it up tomorrow because all of us have questions on it.
Okay, so I do got a motion. Yes, Councilman Dillon.
On my
Yes,
the
sir.
last vote, my vote was yes. I lost signal just as I was about to vote.
Yeah, right.
Yes, Robin, that's right. But I got it.
All right.
Okay, I'll acknowledge for the record. I'll acknowledge that vote. Councilman Dillon, Madam Secretary, if you can record his vote as yes.
Recorded
For the last action.
and okay, recorded, and the count is 15 yes, 2 not voting.
Okay, thank you. I
Thank
have
you.
a motion to I have a motion to adjourn in a second. Madam Secretary, call for the vote, please.
Dwayne Yellowhawk,
Yeah.
Garfield Apple, Glenn Gibbons, Lydia Bearkiller,
Yes.
James Cross,
Yes.
Sonia Littlehawk Weston, Jackie Sears, Benson Tulance, Craig Dillon,
Yes.
Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentina Merdanian, Ryan Jumping Eagle,
Yes.
Bo Little White Man,
Yes.
Chancey Wilson, Richard Greenwald,
Yes.
Robin Tapio,
Yes.
$14 yes, 3 not voting.
14 yes, 3 not voting. Motion carried. Meeting adjourned at 17:42. Thank you very much, Tribal Council, the attorneys, and Madam Secretary. Also, Tribal Council, if you can remember Secretary Spotted Bear in your prayers.